Tools for tools for diagnosis in tribal region Tools for diagnosis in tribal or regional language are also limited. Without better data and culturally turned tools, we will keep missing key pieces of India's mental health story. In the end, the shift from Devta to diagnosis is not about replacing faith with science, it's about finding harmony between both. Healing in India is plural, cultural, and evolving. When faith and science learn to listen to each other, we create a kind of mental health system that feels not just medical but human. The bridge between Devta and diagnosis is where true healings begin. Thank you.
It was nice presentation. So if anyone have any questions or query, then they can ask. Okay. So thank you, Raki, for your presentation.
Thank you, sir.
So as we move forward, I would like to next call Preeti and Naveen Singh Rawat from K.R. Mangalam University, Haryana for their presentation. Next, can you hear me? Preeti and Naveen Singh Rawat from K.R. Mangalam University.
Yes, sir, we can hear you.
Yeah. So
Good afternoon, everyone. My name is Preeti, a postgraduate psychology student, along with my co-author, Naveen Singh Rawat. And we are presenting a research titled Online Marketing Work Demands and Employee Mental Wellbeing, a qualitative systematic review. So basically, this this study explores how the increasing demand of online marketing, such as constant connectivity, digital overload, and performance pressure, affects employees' well-being, psychological well-being, and the research also examined how anxiety and locus of control shapes individual coping responses to digital stress. And the shift to the remote and digital well-being since COVID-19 pandemic has made employee mental well-being a vital concern. The review highlights that anxiety and locus of control and the job demands are the key factors influencing how individuals cope with digital work stress. And also, understanding these psychological differences can help organization design better support system and promote healthier and more resilient workplace for their employees. So the next question is like, what are the study objectives? This review will investigate how work required in the online marketing affects employee mental well-being, recognize the mediating functions of anxiety and locus of control in modulating reaction to digital workload, investigate in all the sectoral differences in the impact of digitalization on the mental health. So, as you can see, like we have used the methodology. The study employed a qualitative systematic literature review in accordance with the PRISMA model, PRISMA guidelines. 18 qualitative articles between 2020 to 2024 were accessed from database such as Science Direct, Springer Link, Frontier, and ResearchGate. So the themes were established by the thematic sensitization, Braun and Clark, with attention to digital work requirement, response to anxiety, locus of control, and coping in the organization. So basically, these studies include digital work demand and psychological stress, performance pressure and anxiety, locus of control as a coping mechanism, digital overload and work life boundaries, sectoral differences, psychological flexibility and resilience, techno stress and emotional resilience, and organizational support system. So basically, if we conclude all the studies, we got a finding. The five common themes were found on the analysis of 18 studies. Like first was digital overload, as I already mentioned. Endless online use leads to exhaustion and mental stress. The second was stress and performance pressure. The performance target and frequent scrutiny heightened the stress. Third was locus of control. Internal locus reduce stress, external locus increase the anxiety. The more is internal locus will reduce the stress, and the external locus will increase the anxiety of an individual. Work life imbalance. The hyperconnectivity interferes with the relaxation and recovery. The fifth finding and the last finding was supportive culture. This like leadership, empathy, and digital literacy training enhance the resilience. There were some implication of this also. So the research emphasized the importance of organizational mindfulness, adaptable policies, and boundary management within the virtual workplace, employee training in cultivating an internal locus of control and emotional regulation can act as an anxiety buffer. Sector-specific treatment, including digital detox, intervention, and planned offline time can preserve psychological equilibrium. So basically, the implication was this, and the conclusion was from the all the studies was this, that you should reduce the digital workload, and you should enhance the you should intervention and plan the offline time more for your employees and for their mental well-being, and preserve a psychological equilibrium. So as of now, I would like to conclude our research. The first was the virtual work dependence has created new mental challenges, and also locus of control and anxiety determines how worker handle the digital stress. Here also, internal locus is a better adaptation to online demands, and high anxiety is like more psychological strain and tension. Organization must recognize mental effect of online workload, promote psychological resilience alongside the productive goals, encourage autonomy, stress reduction programs, and work-life balance, and aim also, which is very important, and aim for the sustainable balance between well-being and efficiency in digital workplace. Thank you, and here I would like to conclude.
Thank you so much for nice and wonderful presentation. If anyone has any query or question, you can ask anyone from the audience. Okay, I just want to ask one thing, that you use term mindfulness. Are you getting my voice?
Yes, I'm
Yes,
getting your voice.
yes, you use term mindfulness. So can you please tell that from where the term mindfulness or the concept of mindfulness came?
See, basically what mindfulness is, it's like a equality of state of being conscious and aware of something. So basically mindfulness is comes in the umbrella of positive psychology,
Okay.
and all the Buddhist techniques, Zen Buddhism and meditation works on mindfulness, and which is like activating your mental state and focusing on your awareness, the present moment and the consciousness, and acknowledge them to calmly present your feelings and thoughts. It's like all over, like we do meditation, we do yoga exercises, pranayam. So it's all about being in a state where you can experience your conscious thoughts and aware of your thought process.
Yes, basically it is associated with the Buddhistic psychology or the Buddhism. So, uh, another just sequel to this question, have you named any technique, therapy, or some process, including mindfulness? Have you any name that which therapy in psychology or that include mindfulness?
Okay, so basically, yoga and pranayama are the best therapies, which we because they all are, Indian, like they are oriented from Indian psychology. But if we talk about in terms of all over psychology, there are few techniques which we use in in the place of as mindfulness techniques. One is like meditation types. There are different types of meditation, breath boxing, and army type of meditation, and focus attention meditation, mantra meditation, and there are many more. So
Yes.
basically, apart from
Basically,
this, there is
meditation covers the mindfulness. Yes.
yeah, and apart from this, there is one more technique which we psychologists mainly use is JPMR, Jacobson Progressive Muscle Relaxation Technique. It's all about relaxing your muscles and to tense it and then relax it.
Okay. Yes. Good. Thank you very much once again. And there
Thank
is, I think, MBCT, mindfulness behavior cognitive therapy, is also nowadays used by various psychologists.
yeah,
Wonderful presentation once again, and for your insightful research work. Thank you so much.
thank you so much.
Now, we are moving to the next participant. And before moving to the next participant, if someone who has not their name in the schedule and they still join us, so please wait for concluding or the after the concluding these research paper participants. Then after they will have their chance, they will have their turn. So after these completion of these presentation, the rest of the participant or the who are going to present their research papers, they will provide their time and they will share their PPTs after the schedule has been completed. Okay. So they will definitely, and if in your touch, if anyone who is not still present here or from your university institution who has to provide the presentation through online mode, you can also inform in between that the online presentation is going on right now. So he or she can join us through Zoom and be prepared for his or her presentation after the schedule is completed. So I would also like to request all of you, if anyone in your known who is not presented the research paper and wants to present through online, you can also inform in between. So they can also prepare from their side after these presentation. Okay. So now I am moving towards our next participant. Give me a second. I am calling the name and the institute. So next we have Dr. Kamni Kaur from University of Delhi. So ma'am, if you are here and present in the meeting, you can start your presentation. Dr. Kamni Kaur ma'am. Okay. when she joined, we will go for her. Himanshi Pal has already presented with her guide. Now we are moving to Ritu from Swami Ram Himalayan University. Uh, Ritu, if you are here, you can start your presentation.
Yes. Hello, Hari Om, and myself Ritu from Swami Rama Himalayan University, and I am presenting the role of Brahmari Pranayam in stress reduction and glycemic control in gestational diabetes mellitus, a systematic review. पहले तो हम ये समझते हैं कि जीडीएम है क्या। गेस्टेशनल डायबिटीज हमारा किसी भी तरीका ग्लूकोज इंटॉलरेंस होता है जो प्रेगनेंसी के टाइम पे होता है। अब जब भी हमारा ग्लूकोज बढ़ता है तो इससे क्या होता है कि हमारे बेबी और मदर दोनों की ही जो हेल्थ होती है उस पर बहुत ज़्यादा इफेक्ट पड़ता है कि बेबी को हो सकता है कि उसका जब डिलीवरी हो तो उसका जो बेबी का साइज़ है वो नॉर्मल से बहुत बड़ा है। हो सकता है कि बेबी को लाइफ टाइम शुगर की दिक्कत रह सकती है। तो जीडीएम की वजह से हमारे मैटरनल और नियोनेटल इम्प्लीकेशन से आप बहुत ज़्यादा कॉम्प्लिकेशंस आगे आ सकते हैं। और जब प्रेगनेंसी के टाइम पे जब मदर को ये पता चलता है कि उसका जो शुगर है वो बढ़ा हुआ है तो उसको इतना ज़्यादा स्ट्रेस होने लगता है कि अब मेरे बच्चे का मतलब मेरा ग्लूकोज बढ़ा हुआ है, शुगर बढ़ा हुआ है, अब इसका मेरी बेबी की हेल्थ पे क्या स्ट्रेस क्या इफेक्ट पड़ेगा। तो वो बार बार डिमांड करते हैं, वो बार बार अपना ग्लूकोज लेवल चेक कराते रहते हैं। और जब उसका मैटरनल स्ट्रेस बढ़ता है तो उसकी वजह से जो हमारा सिंपैथेटिक नर्वस सिस्टम है वो एक्टिवेट होता है, साथ ही साथ हमारा एचपी एक्सिस भी एक्टिवेट होता है, जिसकी वजह से हमारा कॉर्टिसोल लेवल इंक्रीज होता है और हमारा इंसुलिन रेजिस्टेंस होता है। जो बार बार अगर वो मदर स्ट्रेस लेती रहेगी, बार बार हमारा कॉर्टिसोल रिलीज होता रहेगा तो इंसुलिन रेजिस्टेंसी बहुत ज़्यादा हो जाती है, जिसकी वजह से जो ग्लाइसेमिक कंट्रोल है वो खराब होता चला जाता है और हमारा शुगर लेवल बढ़ता ही रहता है। तो अब इस टाइम पे एक ब्राह्मरी हमारा एक ब्रीदिंग टेक्निक है जिसमें हम हमारे ईयर्स एंड आईज को बंद कराकर हम हमिंग साउंड प्रोड्यूस कराते हैं। तो जब भी हमारा ईयर और आईज बंद होंगे और हम हमिंग साउंड प्रोड्यूस करेंगे तो वो हमारे क्या है वेगस नर्व को स्टिमुलेट करती है, और जब हमारी वेगस नर्व स्टिमुलेट होगी वो हमारा पैरासिम्पैथेटिक नर्वस सिस्टम को एक्टिवेट करती है, जो हमारा बिल्कुल अपोजिट है सिस्टम सिंपैथेटिक नर्वस सिस्टम के। और वो हमारे बाद में चलकर जो हमारा हार्ट रेट है, बीपी है, इन सब को कम करेंगे और हमारा एचआरवी को इंक्रीज करेंगे और हमारे इंसुलिन रेजिस्टेंसी में हेल्प करते हैं। साथ ही साथ क्या कहते हैं कि हमारा जो वाइब्रेशन हो रहा है, हमिंग हमने हमिंग साउंड करी और उसके बाद जो हमारा वाइब्रेशंस है वो हमारे लिम्बिक स्ट्रक्चर को एक्टिवेट करता है, हमारे एमिगडाला को एक्टिवेट करता है, जिसकी वजह से हमारे इंसुलिन एब्जॉर्प्शन में या इंसुलिन का अपटेक कराने में मसल्स में बहुत हेल्प मिलती है। तो जो हमारी स्टडी का जो एम है वो है टू सिंथेसिस द एविडेंस ऑन ब्राह्मरी एफिकेसी फॉर रिड्यूसिंग स्ट्रेस एंड इम्प्रूविंग ग्लाइसेमिक कंट्रोल इन जीडीएम। अगर हम बात करें मेथडोलॉजी की तो रिव्यू डिज़ाइन हमारा है सिस्टमेटिक रिव्यू इन अकॉर्डेंस विद द प्रिज्मा गाइडलाइंस। एलिजिबिलिटी में हमारा पीको है, हमारी पॉपुलेशन है प्रेग्नेंट वुमेन्स विद गेस्टेशनल डायबिटीज मेलाइटस। इंटरवेंशन हमारा ब्राह्मरी प्राणायाम में है। हम जो कंपैरिजन करेंगे वो स्टैंडर्ड केयर जो दी जाती है जब अगर किसी का भी ग्लूकोज बढ़ा हुआ है प्रेगनेंसी के टाइम पे तो उनको जो स्टैंडर्ड केयर या एमएनटीज दी जाती हैं उससे कंपैरिजन करेंगे। हमारे आउटकम दो हैं, एक है हमारा प्राइमरी आउटकम जिसमें हमारा स्ट्रेस और एंजाइटी है, सेकेंडरी आउटकम में हमारा ग्लाइसेमिक कंट्रोल है जिसमें हमारा फास्टिंग ब्लड ग्लूकोज, पीपी ब्लड ग्लूकोज, HbA1c है। हमने जो सर्च किया था, सर्च स्ट्रेटजी की बात करें तो हमारे डेटा बेसिस से हमने जो सर्च किया वो थे स्कोपस, पबमेड वगैरह, पबमेड थे। हमने जो जब सर्च किया था तो हमने बुलियन ऑपरेटर्स ऑन एंड एंड का यूज़ किया और जो टर्म यूज़ किए गए थे वो था ब्राह्मरी, जीडीएम, स्ट्रेस, ग्लाइसेमिक कंट्रोल। जब डेटा एक्सट्रैक्शन जब हमारे डेटा हमने सर्च किया डेटा बेसिस पे, उसके बाद जब हम डेटा एक्सट्रैक्शन कर रहे थे तो हमने उसमें प्री पायलटेड फॉर्म्स को यूज़ किया गया जिसमें हमने स्टडी डिटेल्स, मेथड्स, आउटकम की फाइंडिंग्स के बेसिस पे हमने डेटा को एक्सट्रैक्ट किया, स्टडीज़ को फाइनलाइज किया। और बाद में जो क्वालिटी असेसमेंट किया गया स्टडीज़ का वो जो हमारी रैंडमाइज कंट्रोल ट्रायल स्टडीज़ थी उनका हमने ROB2 से किया, और जो नॉन रैंडमाइज कंट्रोल ट्रायल स्टडीज़ थी उनका रॉबिन्स वन टूल्स के द्वारा क्वालिटी असेसमेंट किया गया कि इसमें किसी भी तरह का बायसनेस है या नहीं है। जब स्टडी सिलेक्शन किया गया तो हमने प्रिज्मा गाइडलाइंस यूज़ की गई थी, तो टोटल हमारे 187 सर्चेज आए थे जब हमने डेटाबेस पे सर्च किया। उनमें से स्क्रीनिंग करने के बाद हमारे पास टोटल 142 बची स्टडीज़। उसमें से 127 को हमने एक्सक्लूड कर दिया। आइदर या तो उनका हमारे पास फुल आर्टिकल नहीं था, या फिर उनके प्रॉपर हमारी स्टडी से रिलेटेड नहीं थे। तो लास्ट में हमारे पास 15 स्टडीज बची। उनमें से भी 10 स्टडीज को एक्सक्लूड कर दिया गया, आइदर बिकॉज ऑफ द रॉन्ग इंटरवेंशन और बिकॉज ऑफ द रॉन्ग पॉपुलेशन, और उनका कोई रेलिवेंट आउटकम नहीं आया। तो लास्ट में हमारे पास 5 स्टडीज फाइनलाइज आई, जो हमने अपनी स्टडी में इंक्लूड करी हैं सिस्टमेटिक रिव्यू में। 5 स्टडी कौन सी हैं? पहली है मोहम्मदी की, जो उनका स्टडी डिजाइन था रेंडमाइज कंट्रोल ट्रायल। उन्होंने टोटल 60 पार्टिसिपेंट लिए थे, 2 ग्रुप्स में, 30-30 के ग्रुप्स में। उन्होंने इंटरवेंशन टोटल 6 वीक्स का इंटरवेंशन दिया। 10 मिनट भ्रामरी प्राणायाम कराते थे 2 टाइम्स पर डे। साथ ही साथ उन्होंने स्टैंडर्ड केयर भी देते थे। इट मीन्स वो जो प्रेगनेंसी में जो वुमेन्स हैं उनको एमएनटी पे रखते थे। और जो उन्होंने आउटकम्स मेजर किए थे वो था हमारा प्रेसिव स्ट्रेस स्केल, स्टेट रेट एंजाइटी इन्वेंट्री, फास्टिंग ब्लड ग्लूकोज और पीपी। दूसरा था लीका। उन्होंने प्री पोस्ट पायलट स्टडी थी। जो पार्टिसिपेंट इंक्लूड उन्होंने किए थे वो टोटल 40 पार्टिसिपेंट थे, सिंगल ग्रुप था। उन्होंने 8 हफ्ते तक अपना इंटरवेंशन दिया, 5 मिनट्स भ्रामरी कराते थे 1 टाइम पर डे। साथ के साथ वो एमएनटी पे रखते थे पेशेंट्स को। इसमें उन्होंने जो आउटकम्स मेजर किए थे वो था हमारे पीएसएस, HbA1c और कॉर्टिसोल। तीसरा हमारे देश पांडे की स्टडी इंक्लूड की गई, जो आरसीटी थी। उन्होंने टोटल 85 पेशेंट लिए, इंटरवेंशन ग्रुप में 43 और कंट्रोल ग्रुप में 42। 12 वीक्स तक इंटरवेंशन दिया, 15 मिनट्स भ्रामरी प्राणायाम कराते थे 1 टाइम पर डे। साथ के साथ एमएनटी पे जो पेशेंट्स हैं उनको एमएनटी पर रखते थे। उन्होंने जो आउटकम्स मेजर किए थे वो थे हमारा स्टेट STAI, फास्टिंग ब्लड ग्लूकोज, पीपी और HbA1c। फोर्थ स्टडी हमारी अय्यर की थी। उन्होंने नॉन आरसीटी थी उनकी स्टडी डिजाइन। टोटल 103 पेशेंट थे। इंटरवेंशन ग्रुप में 52 थे एंड कंट्रोल ग्रुप में 51 पेशेंट को रखा गया। 4 हफ्ते तक हमारी स्टडी चली, जिसमें भ्रामरी प्राणायाम को 2 टाइम्स पर डे कराते थे 10-10 मिनट के लिए। उन्होंने जो आउटकम्स मेजर किए उसमें उन्होंने PSS, FBC और PP उन्होंने मेजर किया। लास्ट स्टडी जो थी वो हमारे शर्मा एंड कपूर की थी। उनका स्टडी डिजाइन RCT था। टोटल 40 पेशेंट लिए थे, दोनों ग्रुप्स में 20-20। उन्होंने 8 हफ्ते तक अपनी स्टडी रखी। 10 मिनट भ्रामरी प्राणायाम कराते थे 2 टाइम्स पर डे। जो उन्होंने आउटकम्स मेजर किए वो था स्टेट रेट एंजाइटी इन्वेंट्री, फास्टिंग ब्लड ग्लूकोज, पीपी और HRV। अगर हम बात करें कि उन्होंने जो इंटरवेंशन दिया उसका क्या इफेक्ट पड़ता है, हमारे 2 आउटकम्स है, फर्स्ट हमारा प्राइमरी और सेकेंडरी। तो पहली बात हम बात करते हैं प्राइमरी आउटकम्स की, जिसमें हमारा था स्ट्रेस एंड एंजाइटी। तो जो हमारा मोहम्मदी और अय्यर की जो स्टडी थी वो बताती है कि जो पीएसएस था, जब उन्होंने भ्रामरी प्राणायाम कराया और उसके बाद जब उन्होंने पीएसएस वाला क्वेश्चनर फिल कराया, तो उसमें जो मीन रिडक्शन आया था मीन में, तो वो 6.5 मीन रिडक्शन आया था। साथ के साथ स्टेट रेट एंजाइटी इन्वेंट्री में हमारा देश पांडे और शर्मा कहते हैं कि स्टेट रेट एंजाइटी में मीन रिडक्शन 8.4 पॉइंट्स का था आफ्टर ब्राह्मरी प्राणायाम। साथ ही साथ मोहम्मद और देश पांडे ने बताया कि जो हमारा फास्टिंग ब्लड ग्लूकोज है, जब भी हम ब्राह्मरी प्राणायाम कराएंगे, जब हमारा प्रेगनेंसी में ग्लूकोज बढ़ रहा है, तो उससे हमारा जो फास्टिंग ब्लड ग्लूकोज है वो 15.2 mg/dl डिक्रीज हो जाता है। साथ ही साथ और जो मोहम्मदी और देश पांडे ने ये भी बताया कि जो हमारा पीपी है, ब्लड पोस्ट प्रेंडियल ब्लड ग्लूकोज है, उसमें भी हमारा रिडक्शन आता है भ्रामरी प्राणायाम कराने से। और HbA1c में सिग्निफिकेंट डिक्रीज हुआ था। हमारा HbA1c 0.4 और 0.4 हमारा रिडक्शन हुआ था हमारे इंटरवेंशन ग्रुप में। एंड जो हमारा कंट्रोल ग्रुप था उसमें 0.1 का रिडक्शन था। अगर हम बात करें बायोमार्कर्स की, जिसमें कॉर्टिसोल और HRV को भी मेजर किया गया था, तो ली बताते हैं कि कॉर्टिसोल में हमारा डिक्रीज हुई था, हमारा कॉर्टिसोल बेसलाइन से, और HRV में भी हमें इंक्रीज देखने को मिला था। अगर हम बात करें डिस्कशन ऑफ फाइंडिंग्स की, तो पहली बात हम करते हैं समरी ऑफ एविडेंस। जितने भी हमने समरी हमने इंक्लूड किए, जितने भी आर्टिकल्स, जितनी भी स्टडीज अपने सिस्टमेटिक रिव्यू में, वो बताते हैं कि जब भी ब्राह्मरी प्राणायाम कराया जाएगा उससे हमारे जो साइकोलॉजिकल डिस्ट्रेस है वो कम होगा ही होगा, स्ट्रेस और एंजाइटी कम होगा ही होगा। साथ के साथ हमारे फिजियोलॉजिकल काम होगा। इसका मतलब ये है कि जब भी ब्राह्मरी प्राणायाम कराएंगे, जो हमिंग साउंड होगी उससे हमारा जो कॉर्टिसोल है वो डिक्रीज होगा, क्योंकि ब्राह्मरी प्राणायाम से हमारा सिंपैथेटिक नर्वस सिस्टम एक्टिवेट हो सॉरी पैरासिम्पैथेटिक नर्वस सिस्टम एक्टिवेट होता है। वो हमारे SNS और HPA एक्सिस की हाइपर एक्टिविटी को कम करता है। साथ ही साथ हमारा HRV हमारा इंक्रीज होता है। एंड लास्ट हमारे ग्लाइसेमिक कंट्रोल, जिसमें हमारा फास्टिंग ब्लड ग्लूकोज है, पीपी है, HbA1c है, उसमें भी हमें कमी देखने को मिलती है। अगर बात करें इसके कि कैसे कैसे हमारा ब्राह्मरी प्राणायाम काम करता है, जो हमने स्टडीज देखी उसके बेसिस पे, तो पहला ब्राह्मरी प्राणायाम में हमारा वेगल स्टिमुलेशन कराता है, साथ ही साथ हमारे पीएनएस की एक्टिविटी को बढ़ाता है, जिससे हमारा हार्ट रेट, बीपी कम होता है एंड एचआरवी इंक्रीज होगा है, जिससे कि हमारा ग्लाइसेमिक कंट्रोल में बहुत मदद मिलेगी और हमारा स्ट्रेस भी कम होता है। दूसरी बात, जब भी हम हमिंग साउंड करेंगे तो हमारा लिम्बिक सिस्टम मॉड्यूलेशन होता है, जिससे हमारा एमिगडाला और हिप्पोकैम्पस भी वाइब्रेशन की वजह से एमिगडाला हिप्पोकैम्पस मॉड्यूलेट होता है, जो हमारे जो फियर और स्ट्रेस रिस्पॉन्स होता है कि हमारी बेबी की हेल्थ ठीक है या नहीं है, कैसा होगा, डिलीवरी नॉर्मल होगी कि नहीं होगी, शुगर बढ़ा हुआ है तो कैसे बेबी की हेल्थ पे अफेक्ट पड़ेगा, तो उन सब चीज़ों को फियर और स्ट्रेस रिस्पॉन्स को कम करता है। और जब हमारा फियर और स्ट्रेस रिस्पॉन्स कम है तो ग्लाइसेमिक कंट्रोल और कॉर्टिसोल लेवल कम होगा, ग्लाइसेमिक कंट्रोल हमारा अच्छा होगा। तीसरा, हमारा जब भी हम भ्रामरी प्राणायाम करते हैं हम अपने आइज और ईयर को बंद करते हैं, जिसकी वजह से हमारा सेंसरी विड्रॉल होता है। इन रिस्पॉन्स टू दैट हमारा जो एक्सटर्नल स्ट्रेसर्स है उससे भी हमारा विड्रॉल होता है, जो हमारी माइंडफुलनेस को इनहेंस करती है, और जो हमारे बार बार जो थॉट्स आते हैं कि कैसी हेल्थ है, कैसा नहीं है, क्या करना चाहिए, क्या हमें लेना चाहिए खाने में, क्या नहीं, तो उन सब को रिड्यूस करता है और हमारे स्ट्रेस को कम करके ग्लाइसेमिक कंट्रोल में हेल्प करता है। एंड लास्टली, ब्राह्मरी प्राणायाम क्या करता है, जब भी ब्राह्मरी प्राणायाम करेंगे तो हमारा नाइट्रिक ऑक्साइड रिलीज होता है, जो बाद में हमारा जो नेजल नाइट्रिक ऑक्साइड है उसको इंक्रीज करेगा, जिसकी वजह से वैसोडाइलेशन होता है और हमारा एंडोथेलियल का जो फंक्शन है उसको प्रॉपर करता है, ब्लड फ्लो अच्छा होगा, हमारा बीपी कम होता है, बीपी कम होगा तो हमारा कॉर्टिस ब्लड फ्लो अच्छा होगा, हमारी कॉर्टिसोल लेवल डिक्रीज होता है, जो हमारे ग्लूकोज का अपटेक है, क्योंकि जब हमारा ग्लूकोज बढ़ रहा है तो ऐसा होता है कि गैस्ट्रेशनल डायबिटीज में कि ग्लूकोज तो बन रहा है, इंसुलिन ग्लूकोज बन रहा है, लेकिन वो हमारी मसल्स के द्वारा अपटेक नहीं किया जा रहा, हमारी बस मसल्स उस ग्लूकोज को अपटेक ही नहीं कर पा रही हैं। तो जब हमारा वेसोडाइलेशन होता है, एंडोथेलियल फंक्शंस अच्छे होंगे, तो उस ग्लूकोज का अपटेक हमारी मसल्स में प्रॉपर हो पाएगा, और फाइनल वो हमारी ग्लूकोज का अपटेक अच्छा हुआ तो हमारा ग्लाइसेमिक कंट्रोल में हेल्प करेगा। अगर क्लिनिकल इम्प्लीकेशंस की बात करें तो पहला तो है कि हाईली एक्सेसिबल और स्केलेबल है, सेफ और जेंटल है, कोई भी कर सकता है, कोई दिक्कत नहीं होती। अगर कोई बहुत ज़्यादा हार्ड प्रैक्टिसेस या कुछ ऐसी एक्सरसाइज नहीं कर पा रहा है तो उसको हम भ्रामरी प्राणायाम करा सकते हैं, साथ के साथ एम्पावरिंग फॉर पेशेंट कि पेशेंट अपने आप भी कर सकता है, उनको एक बार सिखाएं तो अपने आप कर सकते हैं। लिमिटेशंस की बात करते हैं करें तो जो भी स्टडीज हमें मिली, पहली बात तो वो बहुत ही कम नंबर की स्टडीज हैं जो अभी तक हुई हैं, साथ के साथ जो उनमें हमारा सैंपल साइज लिया गया वो काफ़ी कम है। उसको और जो उन्होंने ब्राह्मरी प्राणायाम का इंटरवेंशन दिया वो सब में अलग अलग है, किसी ने 10 मिनट कराया, किसी ने 15 मिनट कराया, किसी ने वन टाइम पर डे कराया, किसी ने 2 टाइम पर डे कराया। एंड जो उसमें बायसनेस है स्टडीज में वो काफ़ी हाई रही, जिसकी वजह से हमें जो स्टडीज हैं वो एक्सक्लूड करनी पड़ी अपनी सिस्टमेटिक रिव्यू में। अगर हम फ्यूचर डायरेक्शंस की बात करें तो पहली बात तो क्योंकि सारी स्टडीज हमारी स्मॉल थी तो हम स्टडीज क्या है अच्छे से कर सकते हैं, आरसीटीज कर सकते हैं, लार्ज स्केल पर स्टडीज को कर सकते हैं। हम ब्राह्मरी प्रोटोकॉल को स्टैंडर्डाइज करा सकते हैं कि इतने टाइम में अगर जीडीएम है तो आप इतने टाइम करिए, दिन में इतनी बार करिए। साथ के साथ हम उनका लॉन्ग टर्म इफेक्ट को इवेलुएट इन्वेस्टिगेट कर सकते हैं कि अगर हमने ब्राह्मरी प्राणायाम कराया तो डिलीवरी के बाद भी मैटरनल हेल्थ पे क्या इफेक्ट पड़ा, बेबी की हेल्थ पे क्या इफेक्ट पड़ा है, और इसको हम कॉस्ट इफेक्टिवनेस एनालिसिस करके कि इसका कितना कॉस्ट इफेक्टिव है उस तरीके से इसको इवेलुएट करके इसको इम्प्लीमेंट कर सकते हैं हम अपने डेली रूटीन केयर में या फिर हम हॉस्पिटल्स वगैरह में। अगर हम कंक्लूजन की बात करें, जितनी भी हमने स्टडीज देखी तो ये हमें बताती हैं कि जो ब्राह्मरी प्राणायाम है वो हम एज एन एडजंक्ट थेरेपी यूज कर सकते हैं विद द वुमेन, फॉर द वुमेन जिनका हमारा गेस्टेशनल डायबिटीज मेलाइटिस है, क्योंकि इनके डुअल बेनिफिट होते हैं। पहला तो ये हमारे मैटरनल साइकोलॉजिकल स्ट्रेस को कम करता है, दूसरा ये हमारे ग्लाइसेमिक कंट्रोल में हेल्प करता है बाय मॉड्यूलेटिंग हमारा ऑटोनॉमिक नर्वस सिस्टम को और एचपीए एक्सिस को। तो वी कैन इम्प्लीमेंट या वी कैन हम ये कह सकते हैं कि हम भ्रामरी प्राणायाम को गेस्टेशनल डायबिटीज में यूज हेल्प कर सकते हैं ग्लाइसेमिक कंट्रोल में और स्ट्रेस रिस्पॉन्स को कम करने के लिए। थैंक यू। These are the references and these are the references of my study. Thank
Okay.
you.
Anyone have any query or question regarding this presentation? Then they can ask. Okay. So thank you, Ritu, for your presentation. And now we
Thank
will
you.
move forward. So next, I would like to call Navneet from SRHU, Dehradun, for their presentation. Am I audible to you, Navneet?
या सर,
Yeah, you can
मेरी
proceed with
स्क्रीन
your.
मेरी
Yeah, it is.
स्क्रीन शेयर हो रही है सर।
यहाँ हाँ हो रही है, आपकी स्क्रीन हमें विजिबल
Okay.
है। ओके।
Okay. Thank you, sir. Today's my topic is role of Yog Nidra in managing craving, anxiety, and depression in drug addiction, which is a scoping review actually. यानी इनको हम अपनी पीएचडी की स्टडी में हम एज अ प्रैक्टिस हम शामिल करेंगे। तो मैं आज ये बताना चाहता हूँ कि योग निद्रा किस तरह से ड्रग एडिक्शन में एक प्रैक्टिस के रूप में यूज की जा सकती है। तो सबसे पहले आज हम बात करने वाले हैं ड्रग एडिक्शन के एक ऐसे सॉल्यूशन के बारे में जो पूरी तरह से साइंटिफिक है, हमारे लिए एक्सेसिबल है और पावरफुल है। आज ड्रग एडिक्शन अपने आप में एक बहुत मेजर ग्लोबल प्रॉब्लम बन चुकी है। ये एक क्रोनिक ब्रेन डिजीज है जो हमें लगता है कि ये मॉरल फेलिंग है, और इसका सस्टेन करता है एक ऐसा सर्कल जो जिसमें लगभग तीन चीजें होती हैं। तो वो तीन चीजें कौन सी होंगी वो हम देखेंगे। सबसे पहले इंटेंस क्रेविंग, कि मुझे वो सब्सटेंस चाहिए जो हमारे बार बार यूज करने के कारण होता है, और एंजाइटी, और बाद में डिप्रेशन, और एक क्रोनिक स्ट्रेस। इस साइकिल की वजह से रिलैप्स रेट इतनी हाई है क्योंकि कन्वेंशनल ट्रीटमेंट्स कभी कभी इन अंडरलाइंग स्ट्रेस और इमोशंस को फुली एड्रेस नहीं कर पाता। सो योग निद्रा एक ऐसा सॉल्यूशन बन करके आता है जो इनको कम कर सकता है। योग निद्रा कोई स्ट्रेनियस योगा पोज नहीं है कि जिसमें हम शरीर को, ये शवासन में किया जाने वाला एक टाइप का गाइडेड मेडिटेशन है जो हमें डीप साइकोफिजियोलॉजिकल रिलैक्सेशन देता है, जो हम शवासन में भी कर सकते हैं। और ये डायरेक्टली इसी एडिक्शन साइकिल के टारगेट करता है, जैसे स्ट्रेस को कम करके नर्वस सिस्टम को काम करता है। यह एक साक्षी भाव, जिसे विटनेसिंग अवेयरनेस कहा जाता है, डेवलप करता है। यानी आप अपनी क्रेविंग्स और नेगेटिव इमोशंस को बिना रिएक्ट किए ऑब्जर्व करने की कैपेसिटी डेवलप कर सकते हैं। आज हम इसी टूल्स पर अवेलेबल साइंटिफिक एविडेंसेस को देखेंगे। नेक्स्ट। इसमें हम एविडेंस हमने देखा है, स्कोपिंग रिव्यू किया जिसमें लगभग हमने 14 स्टडीज को इंक्लूड किया। इन स्टडीज से जो पैटर्न हमें दिखा वो क्लियर है। इन एग्जांपल्स को देखें, इन स्टडीज से जो हमने निकाला। सबसे पहले 2022 में रेड्डी ने एक स्टडी की जिसमें अल्कोहल डिपेंडेंस में 12 वीक तक डेली योग निद्रा स्टैंडर्ड केयर तक प्रैक्टिस करवाई गई, जिसका रिजल्ट क्या रहा? क्रेविंग, एंजाइटी, डिप्रेशन और कॉर्टिसोल लेवल और रिलैप्स रेट सब में सिग्निफिकेंस डिक्रीज आया। अब उसके अलावा शर्मा ने, जिन्होंने ये 8 हफ्ते तक उनको प्रैक्टिस करवाया, किनको? मेथाफेटामिन्स यूजर्स को, आई एम सॉरी मैं प्रोनाउंस नहीं कर पा रहा, उनकी क्रेविंग्स कम हुई, एंजाइटी कम हुई और ट्रीटमेंट्स रिटेंशन बेहतर हुई। और सबसे इंटरेस्टिंग स्टडी इसमें 2025 जो लेटेस्ट स्टडी है, उन्होंने फंक्शनल एमआरआई ब्रेन स्कैनिंग करते हुए कोकीन यूजर्स पर योग निद्रा का टेस्ट किया। उन्होंने देखा कि योग निद्रा करने से ब्रेन की क्रेविंग नेटवर्क्स जैसे अमिगडाला और स्ट्रेटम ड्रग्स क्यूज पर कम एक्टिवेट हो रहा है और प्रीफ्रंटल कॉर्टेक्स ज्यादा एक्टिवेट हो रहा है। मतलब योग निद्रा डायरेक्टली ब्रेन्स के सर्किट को चेंज कर रहा है। और ये कैसे चेंज कर रहा है इसको हम यहां से देखेंगे, यानी प्रपोज्ड मैकेनिज्म ऑफ एक्शन इसका क्या रहेगा। तो सबसे पहले फिजियोलॉजिकल लेवल पर ये बॉडी की रेस्ट एंड डाइजेस्ट मोड, पैरासिम्पैथेटिक नर्वस सिस्टम से जिसे हम जानते हैं, उसको एक्टिवेट करता है, जो स्ट्रेस की फाइट और फ्लाइट मोड को बैलेंस करता है। कार्टिसोल कम होता है, हार्ट रेट वेरिएबिलिटी बेहतर होती है। यानी इसको हम कैसे समझेंगे, ये अपने आप में हम आगे अगली स्लाइड में डिस्कस भी करेंगे। जो आपकी HPA एक्सिस होती है, जो आपकी बॉडी का सेंट्रल स्ट्रेस रिस्पॉन्स सिस्टम कहा जाता है, ये कॉम्प्लेक्स कम्युनिकेशन सिस्टम होता है जो हमारे बॉडी के अंदर स्ट्रेस को रेगुलेट करता है। जैसे कि जब भी हमारी बॉडी कोई थ्रेट परसीव करती है तो हाइपोथैलेमस CRH, कार्टिकोट्रोफिन रिलीजिंग हार्मोन, रिलीज करता है, जो ट्रिगर करता है पिट्यूटरी ग्लैंड को ACTH, एड्रीनो कार्टिकोट्रोपिक हार्मोन रिलीज करने के लिए, जो अल्टीमेटली कोज करता है एड्रिनल ग्लैंड को रिलीज कार्टिसोल करने के लिए। तो ये हार्मोन प्रिपेयर करता है बॉडी को स्ट्रेस के लिए। अब हम बार 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 जब ये सब्सटेंसेस लेते हैं तो हम उस स्थिति में बार बार पहुंचते जाते हैं और उसका सिक्रेशन बहुत ज्यादा हो जाता है। आफ्टर दैट नेगेटिव फीडबैक, जब कार्टिसोल लेवल ब्लड में बढ़ता है तो रिसेप्टर्स हाइपोथैलेमस और पिट्यूटरी ग्लैंड डिटेक्ट करते हैं, जो इनिशिएट करते हैं नेगेटिव फीडबैक लूप, जो क्या करता है, रिड्यूस करता है सीआरएच और एसीटीएच का रिलीज, यानी कार्टिसोल लेवल फर्दर रिलीज कम होगा। तो ये आपकी HP1, ये HP एक्सिस का काम होता है। और फिजियोलॉजिकल लेवल हमने समझा, अब हम समझेंगे साइकोलॉजिकल लेवल पर। ये साक्षी भाव जो मैं बता चुका हूं, विटनेसिंग अवेयरनेस सिखाता है। आप सीखते हैं कि क्रेविंग की जैसे कोई एक फीलिंग्स आती है, जैसे हमारे मन में कोई भी एक भाव आया और वो चला गया, तो हम उसको केवल देख पाए, ना कि उससे बहुत ज्यादा प्रभावित हो। तो इस बीच में अगर हम एक गैप क्रिएट कर लेते हैं अपने आने वाले इमोशंस या अपने आने वाले थॉट्स के बीच में, तो हम उनको उनसे दूर हट सकते हैं। ये रिमिनेशंस यानी ब्रेन के नेगेटिव ओवरथिंकिंग को भी शांत करता है, जो डिप्रेशन को कम करता है। इधर हमने HP1 एक्सिस के बारे में पढ़ लिया, HP1 एक्सिस के बारे में। अब PNS एक्टिवेशन के बारे में हम पढ़ेंगे, जैसे शिफ्ट करवाता है SNS को पैरासिम्पथेटिक नर्वस सिस्टम की ओर, यानी फाइट एंड फ्लाइट को रिलैक्सेशन की तरफ, उसके बाद रिलैक्सेशन की तरफ। और दूसरी साइड ब्रेन रिवार्ड स्ट्रेस पाथवेज होता है, वो उसको मॉड्यूलेट करता है। जैसे हमारी बॉडी के अंदर एक रिवार्ड्स होता है कि जिससे हम कोई वो गुड फीलिंग करवाने वाला, और जब हम एडिक्शन या की तरफ जाते हैं ड्रग्स में, तो हमारा वो थ्रेशोल्ड फ्रीक्वेंसी बढ़ जाती है। और उसमें योग निद्रा, जब हम अपने आप को साक्षी भाव के रूप में या HPA एक्सिस मॉड्यूलेशन के रूप में जब उसको कंट्रोल कर पाएंगे, तो जो हमारे लिए मोर बेनिफिशियल हो सकता है, यानी ओवरऑल रिडक्शन इन क्रेविंग एंड इंप्रूवमेंट इन मेंटल हेल्थ। आफ्टर दैट, प्रैक्टिकल एडवांटेज ऑफ योग निद्रा एज एन एडजंक्ट थेरेपी। योग निद्रा की खास बात यह है कि एक प्रैक्टिकल और एक्सेसिबल सॉल्यूशन है। हाई एक्सेसिबल है, यानी आप इसे ऐप बेस भी यूज कर सकते हैं, इनमें कुछ स्टडीज में किया गया है, और अपने घर पर इसको आप स्टडी कर सकते हैं, जिससे आपका जो आपके इंटरवेनिंग वेरिएबल्स हैं या एक्सट्रेनियस वेरिएबल्स हैं वो आपको ज्यादा परेशान ना कर पाए। और एम्पावरिंग, ये पेशेंट को सेल्फ मैनेजमेंट की पावर देता है। जैसे हम किसी से प्रभावित होकर के कुछ समय के लिए छोड़ देते हैं, एडिक्शन में सबसे बड़ी प्रॉब्लम यही आती है कि हम कुछ समय के लिए छोड़ देते हैं और जैसे ही वो चीजें बनती है हम उनमें वापिस से चले जाते हैं। लेकिन ये योग निद्रा, जब आप सेल्फ रियलाइजेशन की तरफ आओगे, सेल्फ विटनेस की तरफ रहोगे, तो आपने आपको खुद से सेल्फ डिसिप्लिन, जो योगा का मतलब ही अनुशासन है, सेल्फ मैनेजमेंट की पावर देता है। और कोमोर्बिडिटी टारगेट करता है, यानी अक्सर पेशेंट को सब्सटेंस यूज डिसऑर्डर्स के साथ एंजाइटी, डिप्रेशन, ये सब हो जाता है, और योग निद्रा एक साथ सबको इनमें टारगेट कर लेता है। तो कंक्लूजन में हम कह सकते हैं कि ड्रग एडिक्शन एक कॉम्प्लेक्स डिसऑर्डर है, जिसके लिए मल्टीफेसिड अप्रोच की जरूरत होती है। और इस अप्रोच में योग निद्रा एक बहुत अच्छी थेरेपी के रूप में उभर कर आ सकता है। अवेलेबल एविडेंस क्लियरली बताते हैं कि योग निद्रा जो है वो क्रेविंग्स में, डिप्रेशंस में एक साथ मैनेज करने की कैपेसिटी रख सकता है, जो एडिक्शन ट्रीटमेंट्स के लिए कोर चैलेंज है। ये ना केवल बॉडी के स्ट्रेस रिस्पॉन्स को रेगुलेट करता है, बल्कि ब्रेन की सर्किट्स को भी पॉजिटिवली इन्फ्लुएंस करता है। तो योग निद्रा को हम कन्वेंशनल ट्रीटमेंट्स के साथ इंटीग्रेट करके एक स्मार्ट और साइंटिफिक अप्रोच यूज कर सकते हैं, जिससे रिलैप्स रेट कम होंगे और लॉन्ग टर्म रिकवरी में हेल्प मिल सकती है। दैट्स ऑल फ्रॉम माय साइड्स। हरिओम ऑल ऑफ यू।
Okay. If anyone have any query or question, they can ask. I think no one. So thank you, Navneet ji, for your presentation. It was very nice presentation. So nice. Next, I would like to call Deepti Methani from Government Degree College, Pranam Ghati, Kotdwar, for their presentation.
प्रणाम सर।
Pranam.
मैं दीप्ति मैठाणी, गवर्नमेंट डिग्री कॉलेज कर्ण घाटी कोटद्वार से। मेरा शीर्षक है हिंदी साहित्य का मानसिक स्वास्थ्य पर सकारात्मक प्रभाव। मानव जीवन का वास्तविक आधार मानसिक संतुलन और आत्मिक शांति है, क्योंकि मन की स्थिरता ही जीवन की दिशा और गति को निर्धारित करती है। किंतु आधुनिक युग में जहां भौतिक उन्नति अपने चरम पर है, वहीं मनुष्य का मानसिक संतुलन निरंतर विचलित होता जा रहा है। प्रतिस्पर्धा, उपभोगवाद, सामाजिक अलगाव और व्यक्तिगत असंतोष ने व्यक्ति को भीतर से अस्थिर बना दिया है। तनाव, अवसाद, चिंता और अकेलेपन जैसी मानसिक समस्याएं अब सामान्य जीवन का हिस्सा बन चुकी है। विश्व स्वास्थ्य संगठन के अनुसार मानसिक स्वास्थ्य केवल रोग की अनुपस्थिति नहीं, बल्कि मनुष्य की संपूर्ण भावनात्मक, सामाजिक और बौद्धिक संतुलन की स्थिति है। इसी संदर्भ में हिंदी साहित्य का महत्व और भी बढ़ जाता है, क्योंकि साहित्य मनुष्य की अंतः चेतना, संवेदनाओं और अनुभवों को अभिव्यक्ति प्रदान करता है। यह केवल मनोरंजन का माध्यम नहीं, बल्कि आत्मचिंतन, आत्मशुद्धि और भावनात्मक शमन का एक सशक्त साधन है। हिंदी साहित्य अपनी गहन मानवीय संवेदनाओं और यथार्थ के साथ मनुष्य को स्वयं से जोड़ता है और उसके भीतर मानसिक संतुलन और आत्मिक शांति की भावना का संचार करता है। वर्तमान समय में मानसिक अस्वस्थता के मामलों में तीव्र वृद्धि एक गंभीर सामाजिक समस्या बन चुकी है। आधुनिक जीवन की तेज रफ्तार और भौतिक आकांक्षाएं व्यक्ति को मानसिक रूप से थका चुकी है। यद्यपि चिकित्सा विज्ञान ने मानसिक रोगों के उपचार हेतु अनेक औषधियां और चिकित्सीय पद्धतियां विकसित की हैं, किंतु केवल दवाओं से मन का उपचार संभव नहीं है। संवेदनात्मक या भावात्मक उपचार की आवश्यकता आज पहले से कहीं अधिक महसूस की जा रही है। इस दिशा में साहित्य, विशेषतः हिंदी साहित्य, एक प्रभावी उपचारक के रूप में कार्य कर सकता है। हिंदी साहित्य न केवल मानवीय मनोविज्ञान को गहराई से समझता है, बल्कि यह व्यक्ति के भीतर छिपे दुख, भय और संघर्षों को शब्दों में रूपांतरित कर भावनात्मक शोधन का कार्य करता है। इसलिए यह आवश्यक है कि हिंदी साहित्य के मानसिक स्वास्थ्य पर पड़ने वाले प्रभावों का विश्लेषणात्मक अध्ययन किया जाए, जिससे साहित्य को मानसिक स्वास्थ्य के संवर्धन हेतु एक सशक्त माध्यम के रूप में स्थापित किया जा सके। हिंदी साहित्य के सकारात्मक मानसिक प्रभाव। साहित्य मनुष्य के जीवन का केवल दर्पण ही नहीं, बल्कि उसके अंतर्मन का साक्षात प्रतिबिंब भी है। यह वह अदृश्य आलोक है जो व्यक्ति के अनुभवों, भावनाओं और संघर्षों के पथ को प्रकाशित करता है। मानव मन की जटिलताओं, अवसाद, चिंता, आघात, अकेलापन और आत्मसंशय तक को साहित्य अपने विविध पात्रों, प्रसंगों और संवेदनाओं के माध्यम से बड़ी सूक्ष्मता से उजागर करता है। जब कोई पाठक उन पात्रों से मिलता है जो अपने मानसिक संघर्षों से जूझ रहे होते हैं, तो वह उनके द्वारा अनुभव की गई पीड़ा में अपनी झलक देखता है और यह समझ पाता है कि उसके अपने संघर्ष भी समाज और मनुष्यता की साझा अनुभूति का एक हिस्सा है। साहित्य सहानुभूति जगाने की एक गहन शक्ति रखता है। यह पाठक को किसी और के दृष्टिकोण से जीवन को देखने के लिए प्रेरित करता है और इस प्रक्रिया में वह अपने भीतर की संवेदनाओं को नई दृष्टि से पहचानने लगता है। जब कोई व्यक्ति उपन्यास, कहानी या कविता के जरिए किसी पात्र के मनोभावों में उतरता है, तो वह अपने ही विचारों और व्यवहारों को भी समझने लगता है। साहित्य का यही गुण उसे न केवल आत्म जागरूक बनाता है, बल्कि मानसिक स्पष्टता और भावनात्मक संतुलन की दिशा में भी अग्रसर करता है। मानसिक स्वास्थ्य के संदर्भ में साहित्य व्यक्ति के भीतर आत्म स्वीकृति, करुणा और दृढ़ता जैसे गुणों के बीजारोपण का माध्यम बन सकता है। साहित्य में भावनात्मक शुद्धि। हिंदी कविता व्यक्ति के भीतर दबी भावनाओं को अभिव्यक्ति देती है। जैसे शंकर प्रसाद जी की कविताएं पीड़ा के माध्यम से आत्म संतुलन सिखाती है। अगर हम में से किसी ने भी जयशंकर प्रसाद की कामायनी का अध्ययन किया हो, तो वे इस बात को और अधिक ढंग से स्पष्ट रूप से समझ सकते हैं। कामायनी में प्रसाद जी लिखते हैं, विस्मृत हों वे बीती बातें, अब जिनमें कुछ सार नहीं, वह जलती छाती न रही, अब वैसा शीतल प्यार नहीं, सब अतीत में लीन हो चली, आशा मधु अभिलाषाएं, प्रिय की निष्ठुर विजय हुई, पर यह तो मेरी हार नहीं। सहानुभूति का विकास। प्रेमचंद के उपन्यास समाज के यथार्थ को इस रूप में दिखाते हैं कि पाठक दूसरों के दुख को साझा कर पाता है। आध्यात्मिक स्थिरता। कबीर, रहीम और तुलसी जी के मानसिक संतुलन और ईश्वर विश्वास के द्वारा जीवन में शांति का संदेश देते हैं। आत्मविकास, आत्मचिंतन, सकारात्मक दृष्टिकोण। हरिवंश राय बच्चन जी की मधुशाला जीवन के संघर्षों को आनंद से देखने की प्रेरणा देती है। मात्र इतने ही नहीं, हिंदी साहित्य के अनेक कथाकार, अनेक कवि अपने समय के किसी भी कथाकार को आप देखें तो आप उनसे अपने अनुभवों को साझा कर सकते हैं। निष्कर्ष रूप से मैं कह सकती हूँ कि हिंदी साहित्य केवल सांस्कृतिक धरोहर नहीं, बल्कि मानसिक चिकित्सा का जीवंत माध्यम है। यह व्यक्ति को आत्मसंतुलन, सहानुभूति और जीवन दर्शन प्रदान करता है। वर्तमान समय में जब मानसिक अस्वस्थता एक सामाजिक संकट बन चुकी है, हिंदी साहित्य के माध्यम से हम एक संवेदनशील, मानसिक रूप से सशक्त और सकारात्मक समाज की रचना कर सकते हैं। अतः हिंदी साहित्य मानसिक स्वास्थ्य सुधार में एक सांस्कृतिक औषधि की तरह कार्य कर सकता है, जो न केवल व्यक्ति को बल्कि समूचे समाज को स्वस्थ बनाता है। प्रस्तुत अध्ययन में मैंने कामायनी, गोदान, रामचरितमानस, त्यागपत्र, शेखर एक जीवनी और मधुशाला के संदर्भों को लिया है। धन्यवाद।
If anyone have any question, then they can ask. No.
धन्यवाद।
Thank you, Dipti ji, for your presentation. So next, I would like to move call Rupali Pundir from Gurukul Kangdi for their presentation.
Hello, am I audible?
Yes, you are audible, ma'am.
And I hope my screen is also visible, sir.
Yes, it is.
Okay. Thank you so much for providing this opportunity. A very good afternoon to each and everyone present here. So, the topic of my presentation is Reviving Garbh Sanskar, a contemporary perspectives on prenatal care and holistic well-being. So, as we all know, that Garbh Sanskar is an ancient Indian practice which is rooted in Ayurveda, yoga, and Vedic literature. It holds a profound significance in nurturing the fetus during pregnancy. There are various historical references also given in the epics like Ramayana, Mahabharata, which underscore its importance. King Dashrath's Putra Kameshchi Yag and Abhimanyu's prenatal learning exemplifies its impact on the progeny. So there are three main aims behind for this paper. Firstly, we have tried to understand what are the diverse phases of Garbh Sanskar and its relevance in today's context. This paper also shed lights on the role of fathers and family members as a positive impact of Garbh Sanskar. The paper also talks about the alliance approach, which aims to augment the practice of Garbh Sanskar by emphasizing the significance of cultural practices and contemporary insights, offering support for well-rounded development of both the child and the expectant mother. Now, the need of the paper could be understood by understanding the modern day challenges of pregnant women. The modern day expectant mothers encounter various difficulties that can greatly affect their physical, emotional, and mental health during pregnancy. One of the primary challenges that most of the pregnant women go through is the stressful nature of contemporary life, which includes the long working hours, commuting, and obligations such as dress code, etc. She also faces a lot of discrimination and sometimes a lack of accommodations. Difficulty balancing career and personal life and pregnancy is one of the common thing that we see through. Along with that, the erosion of the extended family support system in modern societies leave pregnant women and their partners to navigate pregnancy largely on their own. This lack of social support can lead to sometimes the feeling of isolation and overwhelm, which affects the mental health and well-being of the expectant mother as well as sometimes the developing fetus. Financial pressures add another layer of stress to the pregnancy, and as we have seen that these were the there were the societal expectations that were hold on to the women's in the past as well, but in the modern societies as well, there are so many societal expectations and unrealistic demands that ultimately make the pregnancy challenging for an average woman. So, addressing all these factors of an individual life for optimal health emphasizes a comprehensive approach to a prenatal care and overall wellness. So far, I think this topic has started again, has become a topic of discussion. But earlier than that, people were lacking in having a comprehensive approach which could address both the prenatal care as well as the overall practices. So this table shows that there are a number of different sanskars that are included, that are taken place during different stages of fetal development. All these sanskar, as we can see, that they are not very holistically practiced these days. But this is what the idea of this paper is, to revive all those rituals and all the sanskar that were earlier traditionally practiced in today's time as well. So there were in a very short, I've written it down here. So there is a Punsavan Sanskar, Ishpatya Grahan Sanskar, Garbdhanan Sanskar, Garbha Asthanam Sanskar, and Simanto Yana Sanskar, which takes place, which have, every Sanskar has a different purpose, and it takes place at the different times throughout the pregnancy. Apart from that, now we will in detail understand what are different components of the Garbh Sanskar. So there are different components starting from the physical aspect, which includes the diet and the nutrition aspect. So there are so many texts in the Ayurveda which has provided a detailed month-wise dietary and behavior guidelines for pregnant women, aiming to ensure the normal developmental well-being of the fetus. Sattvic vegetarian diet, which promotes the purity and goodness, enhancing strength, happiness, and satisfaction. Conversely, it has also been said that the pregnant women should avoid the Rajogun, Tamogun food, which are associated with passion and ignorance, respectively, due to their detrimental effects on the health and behavior. Yoga and exercises. Specific yoga postures have been put forward through Garbh Sanskar, such as Utkat Kon Asan and Malasan, which helps strengthening pelvic floor muscles and elevate the urinary and other incontinence. Relaxing yoga practices helps to activate the parasympathetic nervous system, promote calmness, and reducing stress. There are certain postures like Supta Baddha Kon Asan, which aids in hip opening and etc., which facilitates the easier labor transitions. Breathing and relaxations. So there are certain breathing exercises and relaxation techniques which may help women manage pain during labor and uh, delivery. Emotional and mental well-being component include the music component. First of all, music also plays a very important and significant role in Garbh Sanskar, influencing the neural connections between the body and the brain, enhancing developmental stages and fostering a stronger bond between the parent and the children. Then there is a pranayam meditations. So there are certain meditations in other meditation is definitely another essential practice during Garbh Sanskar, which helps in reducing the stress, psychological symptoms like low mood, morning sickness, and high blood pressure. Self-care practices may include the journal oil massages, which is very vital during pregnancy to support the body's physiological changes and stay connected with one's body. Then there are spiritual elements which includes the mantras and rituals. Mantras and rituals are always a part of the Garbh Sanskar rituals, which helps into prenatal care journeys such as reciting mantra, performing special spiritual rituals, and listening to calm music or chant. Partners involvement, which is always been emphasized as uh, active involvement of partner in Garbh Sanskar practices and prenatal care activities, fostering a sense of connection and shared responsibility in preparing of childhood and parenthood. So, all these practices not only promote the maternal health but also contribute to the fetal development, ensuring the well being of both the mother and child throughout the pregnancy and beyond. Now, these were the practices that are already known and people were practicing, but not in the umbrella term, not as a one form of practice, but maybe they were practicing in the all these things in a different way. Now, contemporary perspective, in the quest for holistic healthcare, individual turn to alternate approaches like Garbh Sanskar, rooted in ancient traditions for pregnancy and childbirth. Garbh Sanskar offering self-care and bonding technique resonate with those desiring mindful pregnancies. And I think this mindful pregnancy or the conscious conception, this topic is becoming very uh, is gaining a lot of attention these days. So more and more couple are moving towards the mindful pregnancies and the conscious conceptions. But the problem is they do know the concept, but they don't know how they can approach it. So this paper can become the one they can help them in understanding that. So modern Garb Sanskar practices integrate various psychological techniques to support the holistic well-being of pregnant women, such as cognitive restructuring. So contemporary perspective try to include what was traditionally practiced along with the modern techniques such as cognitive restructuring, which can help individual challenge and change and challenge their negative thought pattern. They can promote their positive thinking. They can increase their emotional resilience during pregnancy. Then there are certain behavior modifications techniques which can encourage the adoption of healthy habits and coping mechanism to manage stress and promote relaxation. Then there are counseling sessions, both personal and relationships, that can play a crucial role in addressing emotional concern, providing support tailored to the individual needs of the expectant mother. Counseling also offers a safe space to explore feelings, fears, and expectations related to pregnancy and childbirth, and facilitating emotional processing and personal growth. So by incorporating all these psychological techniques into the traditional Garb Sanskar practices, modern practitioners can aim to enhance the mental and emotional well-being of both the expectant mother, promoting a positive pregnancy experiencing and facilitating optimal fetal development. Now, in the paper in detail, we have included all the evidences that support the outcomes of the Garb Sanskar practices and the impact of all these techniques that I have mentioned earlier. But here in the PPT, I've tried to summarize it under one slide, which is there are certain benefits of Garb Sanskar that have been quoted, which starts with stress reduction. It helps in improving the maternal mental health. It improve the birth outcomes as well. It increases the bondings and attachment between the mother or the family member and the child. And lastly, it helps in the pain management during labor and the delivery as well. Lastly, here are some future directions and recommendations, which includes research and evidence. There's a need to more research and evidence-based practices. There is a elaborative studies that need to be done that talks about how we can integrate the Garb Sanskar practices into maternal healthcare services. So development of standardized training program, definitely there is a need. Technological innovation, how we can use the AI and application based, how we can make it Garb Sanskar more application based, and how we can use the technological innovation in that. Community engagement and education, again, it is very much required, and cultural sensitivity and diversity, because as it is still understood that Garb Sanskar is only limited to Hindu practices, but it is not. It is a very general practice that other culture could also incorporate. So lastly, the conclusion: historically practiced through rituals, dietary adjustments, and lifestyle changes, its significance is found in ancient texts like Ramayana and Mahabharata. Modern research is exploring its potential and benefits, such as reducing maternal stress and enhancing birth outcomes. By blending tradition with contemporary science, Garb Sanskar holds a promise for improving maternal and fetal well-being in today's fast-paced world. So this was the whole concept and the idea behind this paper. These were the references that I've used. And yeah, thank you.
Anyone have any query or question in context of this presentation? They can ask. Okay. Thank you for your presentation. It was a very nice presentation. So
Thank
next
you so much. Thank you so much. Thank you so much.
Now, as moving forward, next I would like to call Nirmala Dimri from SGRR PG College. If you are present, you can unmute and I think Nirmala is not present here. So next I would like to call Devendra Pramar, Lakshmi National Institute of Physical Education.
Yes, sir, I'm present here. Can
Yes,
I
you
go
can.
ahead?
Yes, you can proceed with the presentation.
Sir. So my PPT is visual.
It is right now blank. I think it will be visible.
Blank, sir.
Yeah, it is blank.
Now, sir.
No, not visible. It is blank. You
It is
have to
blank.
share.
Okay, sir. Now,
Yeah, yeah, it is now visible.
okay, sir. Thank you, sir. I'm sorry for the inconvenience for the.
No problem.
Uh,
Yeah.
okay, my name is Devin Singh Parmar. I'm studying as PhD scholar, Lakshmi Bai National Institute of Physical Education, NERC Guwahati. So this is my research topic, and not only research topic. This is my paper topic. My PhD topic is also related to Trataka meditation. So first of all, I'll show my one picture so you can make an image about what I'm trying to say in upcoming PPT. This is the picture of Tratak meditation, where you can see the experiment what I conduct in the study. So this is the Tratak. There is a subject. So he is a focus on the candle gaze as a continuously according to given my instructions and timings. And this is the introduction. This is an ancient discipline and integrate physical, mental, and emotional spiritual dimension of human life. Among the techniques and pratak has been described the yogic scriptures, one of the six purification practice designed to purify mind and senses. The objective of my studies to access the effect of different duration. My topic name is the effect of time duration of Pratak meditation on physiological and cognitive parameters. Actually, this is the experimental study. So I will move on my objective of the study, the different time duration effect of meditation, Pratak meditation on physiological parameters and as well as cognitive parameters. I made two hypotheses. There is a significant difference meditation duration of the physiological and as well as the cognitive parameters. There are some variables related to physiological part and the cognitive part. There I will tell you about the all things. This was my methodology participation. I took 30 male subjects. There is I divided into the two groups, experimental groups in 15 and control group also 15 members were there, and I collected data in three time duration: pre, during, after, post. And this was my methodology.
You are not audible to us. I think there is a network issue. You can. Can you hear me? Am I audible? Can you hear me, Devendra ji?
Hello, sir.
Yeah, yeah.
Yeah, am I audible, sir?
Yeah, right now you're audible.
So okay. Did you hear about object of the study, sir?
You have to repeat it a little bit. There was, I think, network is from your side, so it was we missed that section.
Okay, my methodology was I was talking about my methodology. There I took 30 male subjects and given 6 week of training. I My subject is related to national player, which is related to the different games and which is belongs to the Guwahati also. They played some different types of games on national level conduct like Khelo India and senior national or junior national all players were selected from there. This was my protocol of experiment group frequency of the 5 session per week Monday to Friday and duration 10 to 15 minutes per session, timing evening after of sunset, these things. And this was the questionnaires and tools, physiological parameters for resting heart rate. This is also variable in my study: resting heart rate, respiratory rate, systolic blood pressure, of diastolic blood pressure. The cognitive parameters I selected the Bull mental skills questionnaire. There is a imaginary ability. These all are my variables: imaginary ability, self confidence, relaxation, goal setting, and concentration. See, this is the physiological data collection about the instruments, resting heart rate, polar FTVR, and respiratory rate, observing chest expansion and blood pressure and systolic in the with the help of sphygmomanometer. These are my training photos which I have done during the session. This is Yes, this is the my findings some after the calculation of data analysis. So I got some resulted by the SPSS with the help of SPSS use of ANCOVA analysis of covariance. This is the covariate of free. This is a significant of the some results of time duration. Also, I got the significant. I will just give you the one example about one or two variables, and I have done all the variables in my actual paper. So for a limitation of timing, so I can give you only limited variables. So this is the my ANCOVA emotional intelligence. So here is also got the some improvement result according to my expectation or a hypothesis. There is a F value is greater than P value. So hypothesis verification according to SPSS. So there is a resting heart rate, respiratory, systolic, diastolic blood pressure showed the significant reduction. And also in the cognitive parameters, the goal setting, concentration, stress management, and emotional intelligence. Discussion. We got the significant result about the physiological and cognitive benefits. My suggestion: future study should be include larger, more deserved sample and generalized findings. Long term follow the provide insight to integration of the neurophysiological and comparative study between the different yogic and concentration technique. This is my bibliography. Thank you, sir.
Anyone have any query or question they can ask? Okay. It is very nice job that you are doing, Devendra ji, and
Thank you, sir.
it was very nice presentation. So as we moving forward, now I would like to invite Shreya Sri Baral ji from KR Mangalam University for their presentation.
Good afternoon, sir. Let me share my screen.
Good afternoon. And Devendra ji, kindly
Sir, is my screen visible?
yes, it is.
All right, sir. So, good afternoon, everyone. I'm Shreyashi Baral from Kiamangalam University, and today I am taking you to a quick emotional decluttering journey. So, the topic of my research work is emotional minimalism, simplifying feelings for a fuller life. So, just a second, sir. So, before we begin, I would like to quote a saying that aligns with my research work. As Hans Hoffman once said, the ability to simplify means to eliminate the unnecessary so that the necessary may speak. And I can put it simply as how feeling less can actually help us live more. So, let's see what happens if we apply this idea to our emotions. So, let's be honest, we all live in a world buzzing with notifications, opinions, and emotions overdrive. So, through this concept of emotional minimalism, I want to say that it is about tuning out noise, not by suppressing your emotions, but by curating them. Like Mary Kondo for your feelings, like have an emotional clarity and let go of clutters and finding your peace. So, my research explores how this emotional simplicity influences mental well being, self awareness, life satisfaction, especially from young adults like us. So, the theoretical framework, as you might call it, literature review, is I built my foundation on some brilliant minds. First, Gross taught us about emotional regulation. Cabart and Jen taught us about mindfulness. Salovey and Mayer gave us emotional intelligence, and Beck reminds us that our thoughts shape our emotion. Put them together, and you will get the science behind the emotional balance and clarity, the essence of emotional minimalism. So, this through this research work, the aim of mine was to explore and understand the lived experiences of young adults practicing emotional minimalism and how it influences their mental health and well-being. So, emotional peace is really necessary for having a good mental health and inner peace. So, few objectives of mine include. Like my aim was simple, just to understand how young adults experience emotional minimalism and how it impact their peace of mind. So I explored how with that we are brought to three of my most important research questions. First, how do young adults experience emotional minimalism in daily life? How does this how does simplifying emotions help in self-awareness and regulation? And how does this help in reducing the emotional constraints that we are having? So my propositions, it is a qualitative study. So we would say propositions. So first of my hypothesis were individuals who are consciously simplify their emotions. Responses report a greater emotional balance and reduce stress. H2 suggests practicing emotional minimalism enhances mindfulness and self regulation. And the hypothesis third suggests that emotional minimalism is associated with higher self objective well being and fulfillment. So basically, in methodology, I used a qualitative approach, basically real stories from real people. I interviewed 50 young adults from different backgrounds, students, employees, urban, rural, around for 30-40 minutes each. So basically, I developed a self-developed questionnaire we called emotional minimalism scale. It is a 20-item tool that measures awareness, regulation, and well-being. And then to make it sense of all that rich data, I use something called thematic analysis by Brown and Clark, which is used in qualitative studies. So if we talk about the questionnaire, so you all know that it is a self-made questionnaire called emotional minimalism scale. So it has 20 items based on a Likert scale. So it has 4 subscales: emotional awareness, emotional regulation and simplicity, minimalism and well-being, life perspective, and interpersonal impact. So the scoring and interpretation involves the lowest score as 20 and the highest score as 100. And if we talk about reliability and validity, it has a Cronbach alpha of 0.82, which indicates a very good reliability and validity about the questionnaire. Moving forward to the next slide, how did I make use to of the database I got? So I used something called thematic analysis. So this analysis comes with four four patterns, that is reading, coding, identifying patterns, and grouping them into themes. So I got 5 themes regarding the same: emotional awareness and clarity, mindfulness, mindful regulation and simplicity, emotional lightness and cognitive focus, strengthen relationships and empathy. Hello? Hello?
Yes, yes. Now your voice is clear. A little bit it was breaking, but now it is clear.
All right, so the key findings include emotional minimalism reduces stress and promotes emotional stability, enhances self-awareness and emotional regulation, improves mental clarity, focus, and cognitive balance. It also strengthens relationships, empathy, and interpersonal connections. And emotional minimalism foster inner peace, fulfillment, and overall well-being. And if we talk about correlation, if we are aware about our emotions, we can regulate them. If we keep our emotions simple, it helps in clarifying them and leading us to well-being. A relationship empathy can be found where we can focus on the emotions that are truly important to us, and by focusing upon the emotions that are truly important to us, we can foster inner peace. So few of my research gap includes it has like less of a conceptual clarity and a cross cultural variation, because I use this questionnaire on Indian population and like a limited age group. So I would like to generalize this research work or this questionnaire to cross-cultural differences. Quantitative validation, as you know that my sample size is quite short, so I would like to generalize it by improving or expanding my sample size. And if we talk about limitations, of course sample size is one of them. Demographics, self-report bias, because participants are tend to fabricate the responses, which may affect my research work, and time constraints. Next, we go for future directions and implication. Future studies can help me standardize this questionnaire and the theory of emotional minimalism and conduct cross-cultural, and of course I would like to have a diverse age group as well. And as you know, this research is a qualitative basis, so I would like to have a quantitative validation to this uh, research. And implications include integrating this into mental health so that we can have stress management programs, and we can use this study and research work to teach in schools to enhance resilience and apply in the workplace workplace to reduce burnouts and things. So discussions include uh, emotional minimalism promotes intentional emotional engagement and mindfulness. So about this, our findings have our findings has implicated that participants who practice emotional minimalism have increased self-awareness, clarity, and calmness. And to conclude my research, emotional minimalism reduces psychological distress and enhances inner peace, self awareness, and emotional regulation. It improves personal well being and interpersonal relationships. So, to conclude, emotional minimalism help us not just survive the noise but to thrive in it. These are my references. I use the theory of Gross, Cabot, and Jen and Milburn, and a final vote of thanks to all of you that we can only like foster a true well-being by feeling what truly matters and not by feeling everything. Thank you.
Anyone have any questions? Then they can ask.
I have a question.
Please go ahead.
Yes, as you mentioned about the your self-made questionnaire,
Right.
so I want to just know that what kind of research gap you see the previous questionnaires in the same field and the new one you designed by your own. So what are the gaps you see that should be addressed in your new questionnaire?
So, sir, to address your concern, I believe that this topic is a very new one and untouched, and not many researches have been done. So, what I understand from emotions, I took the help of my emotional understanding and some psychological principles to develop this questionnaire. And as we move forward, as I mentioned in the future studies, I would like to generalize it more and more by generalizing it to the more of sample and more of the age groups. So yeah, this is not a very new subject and new topic, but I still chose to do it because of my understanding and my personal my personal interest and emotions. So this curiosity saved this research basically.
Yes, it's very nice effort. I think so. So this questionnaire has been published anywhere or in any format till now, or
So, sir, I recently worked with a lot of publications. So, this questionnaire has been validated and reliable by them. Only that's why I used it in my research.
okay. Thank you so much.
Okay, anyone else? Okay, it was very nice presentation, and thank you for presenting your research.
Thank you,
So,
sir.
moving forward, now I would like to invite Mrinalini Sabrawal from SGRRU for their presentation.
Good afternoon, everyone. I'm just sharing my screen. I hope my screen is visible.
Yes, it is.
All right. So the topic of my study is because I'm doing my PhD on finding the prevalence of ADHD in Dehradun. So while finding the prevalence, there were certain issues that we found out, like people were not aware of what is the difference between ADHD and autism. So the symptoms were overlapping, so it was very difficult to bifurcate. So that is why I had chose this topic. So my topic is intersecting pathways, a literature review on overlapping symptoms of ADHD, that is attention deficit hyperactivity disorder, and autism spectrum disorder. Attention deficit hyperactive disorder, ADHD, and autism both are neurodevelopmental disorders. Have symptoms of ADHD and ASD. Attention deficit hyperactivity disorder is a neurodevelopmental disorder, as I said. that affects children during the development stage. And the major symptoms of this disorder are mainly three, that is inattention, impulsivity, and hyperactivity. While ASD, autism spectrum disorder, is characterized by persistent defects in social communication. So it is basically related to communication and social interaction across multiple contexts, including deficits in social reciprocity, non-verbal communicative behaviors used for social interaction, skills in developing, maintaining, and understanding relationships. So the aim of my research was to examine the overlapping symptoms of ADHD and ASD among children. In 2025 to find out what are the actual symptoms, overlapping symptoms of ADHD and ASD. Then 52 articles were identified, out of which there were 7 which were duplicate items. So after removing the duplicate items, we had 45 which were screened. Out of 45, there were some which did not go with the criteria. So we had only 15. And out of those 15, we had 10 studies which we had taken for this study. So we had searched about 52 articles, but there were few articles which went with our research. Some were not done on children, some had other comorbid issues. So out of those, only 10 studies were appropriate. So our observations was, first we had comorbidity prevalence. So people who had ASD with ADHD, so earlier which were diagnosed with autism spectrum disorder, also had symptoms of ADHD. So it was found that 50 to 70% of the children with autism met the criteria for ADHD as well, while 32.8% of the children with autism met full criteria of ADHD, with an additional 31.4% of those with subthreshold ASD presenting with ADHD symptoms. The people who had ADHD initially, that is attention deficit hyperactivity disorder, all were also diagnosed with ASD. So it was seen that 20 to 50% of the children with ADHD demonstrated clinically significant ASD symptoms, while 9.8% of children with ADHD met full ASD criteria, while only 5.7% of those with subthreshold ADHD exhibited ASD features. In case of executive functions, both disorders showed effects in cognitive flexibility. So they have problems with the memory span and attention, planning abilities, and their working memory. And children with both conditions had severe executive dysfunction than those with either conditions alone. So the people who had comorbid, that is ASD plus ADHD, they had severe executive dysfunction. Then we talk about the social communication difficulties. So children with both conditions had severe social impairments. So the children which had ADSD and ASD, and including reduced emotional recognition and poorer peer relationships. While if we talk about attention and regulatory problems, so both conditions frequently involve sensory processing differences and emotional dysregulation. So in conclusion, we found out that ADHD and ASD have substantial symptoms overlap. There were a lot of symptoms which are overlapping, which were leading to both clinical challenges and opportunities. And comorbid rates were much higher than the single cases, which was about 50 to 80%. Children with both ADHD and ASD had severe impairments than either alone condition. Accurate diagnosis requires comprehensive, multi-informant and dominant specific assessments, and improved clinical awareness is important. Refined protocols and ongoing research are crucial to better outcomes for affected children. Along with this, I would also like to include that even diagnosis with even awareness among schools is important, so that even teachers know what is the difference between ADHD and ASD. So these were my references that I had taken out of those papers which we had selected. There was the 10 references which we had selected for the review. Thank you.
Any questions or query regarding this presentation? Then okay. It was very nice presentation. So thank you for your presentation. Next, I would like to invite Meena Chan from SGRR University for her presentation. I think she is not present here. So moving next. Next, I would like to invite Gudipati Manjula from Mansarovar Global University for her presentation.
Good afternoon, sir.
Good afternoon.
I'm sharing the screen. Is my screen visible?
Yes, it is.
Good afternoon. My name is Manjula. I am a research scholar from Mansarovar Global University, and I also do practice. I am having my private practice in Hyderabad. The title of the research paper is Technology Interference and Dating App Motivation Among Adults, Exploring Digital Distractions in Modern Relationships. We also know that, yes, digital, especially the smartphone, has led to many mental health issues, not only in individuals, but also I just want to explore in the relationships. That's why I came up with this paper. And this study was conducted among 300 adults. So it was like 18 plus, and the age limit extended to 60 years also. So technology, yes, it has reshaped romantic relationships since the invention of internet in the 1990s. How we have been connecting to the people has been changed with the with this WhatsApp calls, video calls, Zoom calls. We are connecting. Yes, there are many benefits, but also there are associated distractions in the relationships with the technology. For that, I have used two tools, Technoference by McDaniel and Coyne, Dating App Motivation Scale developed by Timmermans and D. Conway. So this study explored how technology interference and dating app motivation differ by age and gender, and how it impacted relationship dynamics. So technoference is defined by the interference of the mobile phones or the smartphones in day-to-day interactions, in the relational communication. So, for example, if the couple are having an important discussion, if either of the partner is involved in the mobile or answers a call, this leads to a conflict, and they are suppressing the important discussion, and the conflicts are escalated because of the use of smartphones. What is the rationale and objectives? The rationale has been the smartphones and dating apps have altered intimacy patterns, and few Indian studies link technoference and dating app use with emotional engagement. My objectives have been in order to examine technology interference and dating app motivation across age and gender, and also to explore relationship. Is there any relationship between technology interference and dating app motivation? So some of the literature review that I had reviewed for this paper is by Neeraj and others. Technoference linked with relational conflict and dissatisfaction. About the dating apps also, what can be the motives? So I had observed that the dating app motivations differed among the male and female, and also across the ages. Males had the intention of this curiosity validation relationship, whereas Bauman and others in 2024, they have also assured that gender differences do occur in using the dating app. The motivations differ among men and women. So according to them, it is that men use these dating apps for exploratory motives, whereas women, the main intentions were in order to have this commitment motives. My hypothesis was towards that first hypothesis, that is that technology interference differed by age, where older adults who are more than 25 years, they felt that yes, the technology interrupted their partner relationships, whereas younger felt that it is part of their day-to-day interactions, where they did not feel that technology or the mobiles interrupted their relational communication. And hypothesis 2 is dating app motivation differed by gender, as I have explained in this literature review, where that Bowman and others have pointed out. My hypothesis also went in that direction, and hypothesis is negatively correlated with dating app motivation. So irrespective of age differences and different ages had the different motives. And my methodology is cross-sectional survey and sample, as I told, it's 300 adults who are more than 18. And 71.3% were females. And the main thing was the Google survey was floated using many media like Insta, Facebook, WhatsApp. These were utilized, and convenience sampling was used, and snowball sampling also, where if the user felt, if the participant felt it was okay, he or she used to float the survey among their own groups. And the instruments used were technology interference scale and dating app motivation scale. The data analysis, I used IBM's SPSS in order to analyze my data. So descriptive statistics, mean, standard deviation, frequencies, and percentages, inferential statistics of Pearson's correlation, independent sample t-test were conducted. ANOVA was used in order to compare the means. Effect size of Cohen's D was also calculated. And yes, ethical from all the participants, and confidentiality was maintained. Yes, the participants were given given the opportunity in order to withdraw or stop doing the survey. And data protection is there. Yes, responses are stored securely and used only for research purposes. Inclusion criteria was the participant has to be an adult who is 18 and above, and has to be in the relationship for minimum of 4 months. Exclusion criteria was if the participant is not meeting the criteria, it was not taken into consideration. These are the results. Like all the hypotheses were supported based on which are in sync with my results, where the technoference was higher among adults, and it was statistically significant, and also effect size was moderate, and dating app motivation was higher among males versus females, and it was also statistically significant, and effect size also moderate. Age is negatively correlated, so there is no correlation between age and dating app motivation. So the same older adults face greater technoference due to maybe multitasking and work demands and maybe family issues. And males showed higher dating app motivation linked to exploratory motives. Younger participants, they were more open to digital romance. Technology interference erodes intimacy and emotional presence, according to McDaniel and Coyne. These are the practical implications. So we need to advocate the technology, tech boundaries in the relationships. We need to know where to draw the boundary, when to use the phones when we are with our partner. Promote emotional engagement and empathy. When we are able to establish the tech boundaries, yes, we will be left with some space in order to have that emotional engagement and have empathy towards the partner. We need to integrate the digital literacy in relationship counseling, where the couple therapists and counselors need to understand, where need to maybe observe and consider this technoference also in their therapy sessions. We need to design gender sensitive psychoeducation programs also. And the limitations and future directions. Limitations are that these cross-sectional design limits, there is no causal inference. And yes, there may be chances of self-report bias, and cultural context needs deeper exploration. Since I stay in south of the country, and yes, our country is like diverse and we are having diverse culture. Maybe the whole India can give me a picture like in different parts of the country what we can get, what is the impact that we can get because of this technoference and dating app motivation. And future research can be longitudinal and cross-cultural comparison. My conclusion is technology interference and dating app motivation, they are shaping the modern relationships, and we need to consider the risks involved in dating app motivation, dating apps, utilization of dating apps, where like fake profiles, cyber crimes, and ghosting, for example. It means that where the partner, if the part one of the either of the partners is not ready in order to commit for a long-term relationship, he or she just leaves the other partner without texting, without informing the other partner. And such risks are involved in utilizing the dating apps, which need to be educated for the younger generations. And other conclusion is age and gender moderate digital relational behaviors. Yes, mindful technology use and emotional presence are key in order to have a relational communication, in order to maintain a healthy relationship between the partners. Yes, technology should be a bridge and not a barrier to a connection. And thank you so much for giving this opportunity to present my paper in this forum. Thank you so much.
Any questions or query regarding this presentation? You can ask.
Yes,
Yes, please.
ma'am, it was a unique and wonderful presentation.
Thank you,
I
sir.
just ask not in a question way, but for a futuristic way. You use dating apps, or we can say the technology overall.
Mm.
So, in your opinion, ma'am, what the impact of these kinds of technologies, or the we can say the cyber engagement in present era on the mental health and psychological well-being? How you see it, ma'am?
Yes, sir. Sir, actually, I'm practicing and I'm seeing the couple, sir, where the intention of the couple when they are using dating apps like Bumble. Bumble, generally, what I learned from my clients is it is meant for casual relationships. But especially the females, they come to me saying that though we started it as a casual relationship, I want to maintain a long-term relationship. But most of the times, it's not, I'm not generalizing, but the male wants to get out of the relationship, which, and here, because the girl is involved emotionally, she doesn't want to come out of it, and the boy feels suffocated. So here both the partners are emotionally impacted because of it, and here it is taking so much of time for the girl in order to come out of it. So she is going into left out, she feels abandoned, left out, and sometimes she is entering into the vicious cycle of sadness and depression. And I have seen one of my clients going to many places in order to calm herself and get out of it and move on to the next prospective relationship. So yes, it impacted, if at all, behaviors like ghosting, like sexting, or fake profiles. These are impacting mental health. These are impacting mentally whoever are involved in this dating apps. However, there are also dating apps such as Hinge, where I learned that this is meant for long-term commitment. Like if they want to go to marriage, they are searching for the partners in order to see whether they are compatible to each other.
Thank you so much. And one thing for just educational purpose, that you see experience along with the research article also. So in very few words, very short words, what you advise as per your research or the experience after seeing these, how they are affecting their psychological health. So from your side, what will be your advice to the teenagers or the young generations regarding the use of these technologies in very few words short?
So, okay, sir. So, in very few words, at least till 24 years, I would suggest no dating apps for Indian youth, because we are in the transition, how to use it, what are the risks and all. So, till at least we are matured enough, no dating apps till 25 years.
Thank you so much.
Thank you, sir.
Thank you, ma'am. It was very nice presentation.
Thank you, sir.
So as moving forward, next I would like to invite Divyanshi Mittal from K.R. Mangalam University for her presentation. Again, I am repeating. Divyanshi Mittal from K.R. Mangalam University. If you are present, then I think she is not present. So moving forward, next I would like to invite Krishna Avatar from SGRR University for his presentation.
Yeah, good afternoon, sir.
Good afternoon.
Myself, Krishna Avatar. I am research scholar from SGRR University, Dehradun. Sir, I am sharing my screen. Yeah. जैसा कि योग के ऊपर काफी सारी चर्चाएं होती है कि योग है क्या, या योग आज की डेट में क्या क्या हम उससे फायदे उठा सकते हैं, जैसे लाइक हेल्थ के पॉइंट ऑफ व्यू से। तो मेरा ये है कि जो योग है वो कैसे एक प्रिवेंटिव और प्रोमेटिव और थेरेपेटिक यूज हम उसका कर सकते हैं, इसका डब्ल्यूएचओ कैसे सपोर्ट करता है और डब्ल्यूएचओ की क्या गाइडलाइंस है, इसके लिए मैं ये हाँ। तो जैसा पता ही है कि योग एक एशियंट ट्रेडिशन है जो भारत की उपज है, और पूरे भारत से ये पूरे ऑल ओवर ग्लोब में, पूरे ऑल ओवर वर्ल्ड में ये योग की जो रूट्स हैं वो इंडिया से ही हैं, और इंडिया से ही पूरे वर्ल्ड में गए हैं। और डब्ल्यूएचओ भी योग को एक मान्यता देता है। डब्ल्यूएचओ ने बताया है कि भाई योग से हम क्या क्या फायदे हमारे हो सकते हैं, और जो डब्ल्यूएचओ की अभी गाइडलाइन बनी थी तो उसमें उन्होंने योग को एक प्रिवेंटिव टूल्स के रूप में स्वीकार किया है। और ये हेल्थ में कैसे इसका थेरेपेटिक यूज हो सकता है। तो जैसा पता ही है कि योग के जो रूट्स हैं वो वैदिक काल से है, सनातन से है, और फिर उसके बाद इसके जो उपनिषदिक उपनिषदों में जो योग का वर्णन वर्णन है, और दो वीसी में महर्षि पतंजलि ने जो योग के ज्ञान को और उसको जोड़ा है, और उसमें अष्टांग योग का मार्ग बताया कि जो अष्टांगिक योग है वो कैसे हमारे मन को, चित्त को, सारी हमारी हेल्थ को कैसे वो सही सही रख सकता है। और फिर 15वीं सेंचुरी में जो हठ योग प्रदीपिका के थ्रू उन्होंने बताया है कि कैसे योग के और क्या क्या डिसिप्लिन है, योग के मीन्स योग के जो अंग हैं जैसे आसन, प्राणायाम, मुद्रा, बंद, ये सारी चीजें हैं, तो उनसे हम कैसे अपने हेल्थ को सही रख सकते हैं। और जैसे पता ही है कि योग आपके शरीर के लिए, आत्मा के लिए और हमारी मन के लिए, इन तीनों चीजों का कारगर है, और इन तीनों चीजों को ये समावेश है। जैसे ग्लोबल एक्शन हेल्थ प्लान फिजिकल एक्टिविटी का 2018-30 का बना है, तो उसमें उन्होंने योग प्रमोट किया है और बताया है कि यदि हम एक हफ्ते में 150 मिनट अगर हम योगिक एक्टिविटीज करते हैं तो वो हमारी मिनिमम, तो वो हमारे हेल्थ के लिए काफी बेनिफिट होता है। और ये हमारे जो भी हमारे फिजिकल है, मेंटल है, सोशल वेलबींग है, उसके लिए हमारा योग योग से हमें काफी उससे फायदा होता है। और योग को जितनी भी एज ग्रुप है, ये जितनी भी पॉपुलेशन है, ये एज ए ग्लोबल धर्म से भी परे उसको सब जो है अपना अपना सके। और कुछ योगा की उन्होंने गाइडलाइंस दी है डब्ल्यूएचओ ने कि योग को कैसे करें, क्या करें, क्या क्या करना चाहिए, क्या नहीं करना चाहिए। तो बताया जैसे कि भाई खाली पेट जो है आपको योग करना है, आपका जो कपड़े हो, ढीले ढाले कपड़े हो पहने हुए, और नाक से ही ब्रीदिंग करनी है, स्लो मूवमेंट करना है। और जैसे कि महर्षि पतंजलि योग दर्शन में कहा गया स्थिरम सुखम आसनम, यानी कि आपके अगर स्थिरता पूर्वक है, सुख पूर्वक है, तो आपको आसन में आपको वो चीजें दिखनी चाहिए कि आपकी स्थिरता हो, सुख हो, और ये सारी चीजें। फिर कुछ सेफ्टी मेजर्स भी हैं कि आपको क्या करना है, क्या नहीं करना। जैसे कहा गया है कि जो क्वालिफाइड आपका इंस्ट्रक्टर हो वो वेल क्वालिफाइड हो, जो आपको अच्छे ढंग से बता सके क्या करना है, क्या नहीं करना। और अगर कोई क्रोनिक डिजीज है, क्रोनिक कंडीशन है, तो आपको आप अपने जो हेल्थ केयर प्रोफेशनल है उनसे एडवाइस लेनी चाहिए कि मुझे क्या करना चाहिए, क्या नहीं करना चाहिए। यदि कोई एल्डरली है, कोई दिव्यांग है, या कोई प्रेग्नेंट है, या कोई ऐसे पेशेंट है आपको, तो उनके लिए कैसे पोजेस को या कैसे हम उनके लिए मॉडिफाई कर सकते हैं उस चीज को। और अगर कहीं ज्यादा तबीयत खराब है, कोई ऐसा प्रॉब्लम हो रही है, बहुत ज्यादा एग्जॉस्टेड है, तो हमें ये प्रैक्टिस जो है अवॉइड करनी चाहिए, या उनको उनके हिसाब से करवाया जाना चाहिए। प्रिवेंटिव रोल में जैसे योग का है, तो इसमें जो नॉन कम्युनिकेबल डिजीजेज हैं उसमें इसके रिस्क फैक्टर को जो है कम करेगा। जैसे हाइपरटेंशन है, डायबिटीज है, ओबेसिटी है, जो हमारी लाइफस्टाइल से रिलेटेड डिजीज हैं, तो उनको कम करने में कारगर है। और जो हमारा कार्डियोवास्कुलर हेल्थ है, हार्ट की हेल्थ है, उसको हमारे इम्प्रूव करेगा, और हमारी इम्यूनिटी को इम्प्रूव करेगा, और जो हमारा इन्फ्लेशन है उसको स्लो डाउन करेगा। थेरेपेटिक बेनिफिट्स अगर देखा जाए, तो पेन मैनेजमेंट में जैसे बैक पेन है, एक पेन है, आर्थराइटिस का है, ये जो भी आपके इस टाइप के पेन है, तो स्लोली स्लोली आपके योग से उन सारी चीजों को मैनेज किया जा सकता है। रेस्पिरेटरी हेल्थ जैसे आपका अस्थमा का है, सीओपीडी का है, या लंग्स से रिलेटेड जो भी प्रॉब्लम है, तो प्राणायाम और उन सारी टेक्निक से, जो सटकर्मा की टेक्निक्स हैं, उनसे ठीक किया जा सकता है। और मेटाबॉलिक डिसऑर्डर्स होते हैं, जैसे डायबिटीज है, तो आपके डायबिटीज के लिए आपकी हार्मोन्स को कंट्रोल करेगा, हार्मोन्स को एक सही बैलेंस में वो करेगा। और कार्डिक हेल्थ में भी योग कारगर है। और योग का अगर मेंटल वेलबींग से देखा जाए, तो जैसे महर्षि पतंजलि ने बताया कि योग चित्त वृत्ति निरोध, चित्त की वृत्तियों का निरोध करना योग है। यानी कि जो हमारे चिंतन है, चिंतन को हमें कैसे सही ढंग से करना है कि जिससे हमारा शारीरिक मानसिक रूप से हम ठीक हो पाए। और मन की बात जो है, श्रीमद् भगवद गीता में भी कही है कि मन को कैसे योग से हम ठीक कर सकते हैं, मन को कैसे काबू में कर सकते हैं, मन को कैसे कंट्रोल कर सकते हैं। तो स्ट्रेस रिडक्शन के लिए योग काफी फायदेमंद है, जो कि हमारे जैसे कॉर्टिसोल को जो है कम करता है, और हमारी एंजाइटी, डिप्रेशन, और जो स्ट्रेस है, स्ट्रेस लेवल को कैसे मैनेज करता है, कैसे उसे पॉजिटिव स्ट्रेस को आगे बढ़ाता है। मेमोरी का हमारा इम्प्रूवमेंट करता है, और जो डिमेंशिया की प्रॉब्लम होती है खास करके बड़ी एज में, तो उसको कैसे डिले कर सकता है, या उसको कैसे प्रिवेंट कर सकते हैं। जैसे जो होलिस्टिक लाइफ फ्रेमवर्क है, या हम ये कहते हैं कि योगा एक होलिस्टिक लाइफ स्टाइल के लिए सही है। तो हमारा जैसे आहार की बात कही है, इसमें डाइट पे काफी ध्यान दिया जाता है कि हमारा सात्विक आहार हो, हमारा सत्वगुण बढ़ना चाहिए। सत्व बढ़ेगा तभी हमारा तमो और रजोगुण जो है डाउन हो पाएगा। अगर हम आचार की बात करें कि हम कैसा आचार करें, हमारे डिसिप्लिन कैसा होना चाहिए, रूटीन क्या नजर से हो, दिनचर्या कैसी हो, रात्रिचर्या, ऋतुचर्या, ये सारी चीजें कैसी है, ये इसके अंदर बिहार बिहार यानी कि हमारे जो बैलेंस है, और रिक्रिएशन कैसा हो कि हम इंजॉयफुल माइंडफुल कैसे रहे हमेशा, हम अपने वर्क लाइफ में कैसे बैलेंस रखें, और जो हमारे विचार है, जो हमारे थॉट है, तो वो कैसे पॉजिटिव रहे, कैसे माइंडफुल रहे। तो इसमें ये सारी चीजें होती हैं। अगर साइंटिफिक एविडेंस की बात करें, तो क्लिनिकल ट्रायल्स जो है ये बताते हैं कि योग का अगर हम उपयोग करते हैं, योग को अगर हम अपने जीवन में शामिल करते हैं, तो हमारा ब्लड प्रेशर है वो सही हो सकता है, हमारा बीएमआई यानी कि हमारी जो ओबेसिटी की प्रॉब्लम है, तो वो सही हो सकती है। और जो अगर इसकी मेटा एनालिसिस की बात की जाए, तो जो डिप्रेशन है, एंजाइटी है, स्ट्रेस है, इसको कैसे योग के थ्रू हम ठीक कर सकते हैं। और न्यूरोसाइंस की जब तक बात है कि जो ब्रेन की प्लास्टिसिटी है, तो वो मेडिटेशन से हम कैसे उसको सही कर सकते हैं, मेडिटेशन हमारे लिए कितना उपयोग कारगर होता है। और योग की अगर ग्लोबल हेल्थ पॉलिसी में योग को इतना वो स्थान दिया गया है, जैसे अभी यूएन ने जो है इंटरनेशनल योगा डे 21 जून को जो है वो डिसाइड किया है, तो उसको हम 2015 से ही सेलिब्रेट कर रहे हैं। और एक योग के प्रति और हेल्थ के प्रति लोगों के अंदर एक अवेयरनेस और मैसेज आ रहा है। डब्ल्यू डब्ल्यूएचओ ने भी ट्रेडिशनल मेडिसिन स्ट्रेटजी में योग को शामिल किया है, और आयुर्वेद के जो सिद्धांत हैं उनको शामिल किया है। और जैसे सभी को पता है कि जो भारत का आयुष मंत्रालय है, वो ऑल ओवर वर्ल्ड में ये इनिशिएटिव ले रहा है कि योग को कैसे प्रमोट करें, योग कहाँ कहाँ पे आपका काम आ सकता है, कैसे काम आ सकता है, योग के क्या क्या बेनिफिट्स हैं। और जो हमारा मॉडर्न हेल्थ सिस्टम है उसमें योग को प्रमोट किया जा रहा है। जैसे अभी हम उत्तराखंड की भी अगर बात करें तो उत्तराखंड में भी इतने जो भी हैं, या हम ऑल ओवर इंडिया की हेल्थ मिनिस्ट्री की बात करें तो एक अलग से आरोग्य मंदिर करके एक सिस्टम का एक प्रोग्राम है हेल्थ हेल्थ सिस्टम का, कि जिसमें योग को प्रमोट किया जा रहा है कि योग से हम कैसे अपनी ये जैसे नॉन कम्युनिकेबल डिजीजेस हैं, मेंटल इलनेस है, ये सारी जो प्रॉब्लम्स हैं, इनको योग को अपनाने से हम उसे कैसे ठीक कर सकते हैं और कैसे हो सकते हैं। और योग एक ब्रिज है जो हमारा एशियंट विजडम थी, जो वैदिक ज्ञान था और जो मॉडर्न साइंस है, उनके बीच में एक ब्रिज का काम कर रहा है। और इसका स्टैंडर्डाइजेशन रिसर्च चैलेंजेस है कि इसमें अभी और ज़्यादा रिसर्च हो और इसमें कैसे ये चीज़ें कर सकते हैं, और योग हमारी लाइफ स्टाइल को कैसे आगे बढ़ाता है, और हम अपनी लाइफ में योग को कैसे सम्मिलित कर सकें। और योग सिर्फ एक एक्सरसाइज ही नहीं है, या बहुत से लोगों का ये है कि एक योग का मीन्स आसन ही योग है, लेकिन आसन एज ए पार्ट ऑफ योग, योग के और बहुत सारे आयाम हैं और बहुत सारे अ, जिनको हम योग करते हैं। जैसे अगर देखा जाए तो श्रीमद् भगवद गीता एक योग का ऑथेंटिक ग्रंथ है, कि जिसमें जैसे बताया गया है कि योग क्या है, समत्वम योग च। अगर समत्व की भावना आ गई, समत्व हो गई, या योग कर्म कौशलम, हमारे कर्मों में कुशलता आ जाए, तो योग योग की मतलब सारी चीजें उसमें समाहित हो सकती है। तो योग हमारा प्रिवेंटिव है, प्रोमोटिव है और थेरेप्यूटिक भी है, ये सारी चीजें इसमें गई। और हमारा इफेक्टिव है नॉन कम्युनिकेबल डिजीजेस के लिए, मेंटल हेल्थ के लिए। और जो WHO का मिशन है कि हेल्थ फॉर ऑल, उस विजन को ये वो करता है, क्योंकि योग के अंदर आपका आपका फिजिकल हेल्थ, मेंटल हेल्थ, सोशल हेल्थ, स्पिरिचुअल हेल्थ, सारी हेल्थ को हम इससे ठीक कर सकते हैं। और इसका जो फ्यूचर स्कोप है वो ये है कि योग को एक मेन स्ट्रीम में आए कि ग्लोबली, नॉट फॉर ओनली इन इंडिया एंड मीन्स एशियन रीजन, बट जितना भी ऑल ओवर ग्लोब है, ऑल ओवर वर्ल्ड है, सब अगर योग को अपनी एक जीवन धारा में जोड़े और डेली लाइफ में योग को अगर उसमें जोड़े, तो जो मेरे ये इसमें रेफरेंसेस मैंने लिए थे, वो WHO का जो ग्लोबल एक्शन प्लान है उससे लिया गया है, पतंजलि योग सूत्र में, क्योंकि चित्त की वृत्ति की बात कही गई है, मन की बात कही गई है, स्थिरम योग सुकन की बात कही गई है, और जो अष्टांग है, यम नियम आसन प्राणायाम प्रत्याहार ध्यान धारणा समाधि, वो सारे पतंजलि योग सूत्र से लिए गए हैं, और उसके क्या इम्पैक्ट पड़ते हैं वो दिया गए। और जो अल्टरनेटिव मेडिसिन हैं, उसकी स्टडीज भी ये बताती है कि योग से हमें क्या क्या फायदा होते हैं, और जो योग से हम आगे वो क्या कर सकते हैं। तो योगा एक ऐसा माध्यम है कि जिससे हम अपने आप को और खुद को, अपनी आत्मा को, शरीर को, मन को, इनको सबको हम आपस में एक सिंक्रोनाइज कर सकते हैं, एक लाइन में ला सकते हैं, और एक हेल्दी लाइफ जी सकते हैं। थैंक यू ऑल। थैंक यू सर। हेलो हेलो।
हेलो, आर यू गेटिंग माय वॉइस?
हाँ सर, मेरी आवाज आ रही? हेलो।
जी सर, आ रही है।
जी जी।
जी, it is such a nice presentation and pointing out the importance of yoga inclined with the World Health Organization and how it is related to our well-being, mental health, or overall holistic health. So, I want to ask uh, one thing from my
Yes.
side, that uh, is there is any difference between man and chit according to Yoga Shastra or Yoga uh, philosophy? If there is
सर
any,
चित्त, सर चित्त, चित्त इज डिफरेंट एंड मन इज डिफरेंट। मन इज कंपोनेंट पार्ट ऑफ चित्त।
okay,
चित्त के अंदर मन, बुद्धि, अहंकार, ये आते हैं।
आपने WHO के विषय में कहा, अभी WHO ने एक ऐप लॉन्च की थी कुछ वर्ष पूर्व फॉर द योगा,
यस सर।
तो उसके विषय में आप कुछ बताना चाहेंगे सर?
सॉरी सर, मैं उस ऐप के बारे में ज़्यादा तो पता नहीं है, लेकिन एक आयुष मंत्रालय ने निकाला था जो जिसमें हमारे आदरणीय नरेंद्र
जी
दामोदर दास मोदी जी उसमें योग करते हुए और लोगों को एक अवेयरनेस का एक मैसेज देते थे,
जी
लेकिन WHO के ऐप का तो सर ज़्यादा।
जी नहीं, बहुत ही अच्छा आपका प्रेजेंटेशन, और वास्तव में ये एक मानवता के लिए, एक समग्र स्वास्थ्य के लिए, और जो योग की उपयोगिता है आज के समय में उसको दर्शाते हुए किस तरीके से उसका उपयोग हम एक समग्र स्वास्थ्य के लाभान्वित के लिए हम उसको कर सकते हैं, हमारे वैदिक सनातन संस्कृति को ध्यान में रखते हुए। तो सर
जी,
बहुत बहुत धन्यवाद आपका एक बार फिर से इस अमूल्य प्रेजेंटेशन।
थैंक यू सो मच सर।
So, moving to the next, before calling out the next presenter, I would also remind that the participants who are here who is not yet presented their paper, so we are going towards them also. So you can also write in the here in the chat box of the Zoom, and I will call because I have some name I am calling from my side. They are Dr. Arpit Kumar Dubey sir. I think his schedule was earlier, but due to some inconvenience, he was not there. So now the next I will call him. After that, I have name of Pragya Manjhi, Pranav Raj, Samriddhi Bais, and Jyoti Dhai. So beyond these names, I pronounce. So if anyone else who is not presented their research paper, you can write directly to the chat also, or in the group also, or to me also. Okay. So moving to the next, I would like to invite Dr. Arpit Kumar Dubey sir to kindly proceed his presentation. Sir.
Yeah, namaste, sir. I am audible.
Yes, sir, you are audible.
Yeah, now I'm just going to share my screen. I hope my screen is visible.
Not yet, sir.
Is it not visible?
No, sir.
From my side, I share it. Just a minute. I hope so.
Yes, now it is visible.
Is it now visible?
Yes, sir. Yes.
Okay. So thank you, sir. Thank you for inviting me to present my research paper. So the title of my research paper is the Bhagavad Gita and the Yoga Sutra, a holistic approach to mental well-being. And the paper is the joint paper. It is written by me, Dr. Arpit Kumar Dubey, Assistant Professor, Moraji Desai National Institute of Yoga, and Dr. Kamini Kaur, Assistant Professor, Mata Sundari College, University of Delhi. So I will try to wrap up my paper within 5 to 6 minutes as per the allotted slot. So very first, what is yoga? So the basic understanding of yoga is that it is an ancient Indian art and science of holistic living. Whenever we say holistic living, so what is the meaning of holistic living? So very simply, we can understand that healthy body, happy mind, and harmonized society is collectively known as the holistic living. Now, there are 3 branches of yoga and 5 schools which are very popular. So there are 3 branches of yoga. First and foremost is the yoga philosophy. Second is the yoga practice. Third one is the yoga therapy. And there are 5 schools of yoga which are known as the Sankhya Yoga, Tantra Yoga, Vedanta Yoga, Buddha Yoga, and Jain Yoga. So now I am directly coming to my topic. So my topic is the Bhagavad Gita and the Yoga Sutra holistic approach to mental well-being. So very first, although in the chronological order, the Bhagavad Gita is placed before the Yoga Sutra, but I will start from the Yoga Sutra because as a preface, I will put some points from Yoga Sutra, then I will switch to the Bhagavad Gita. So Maharshi Patanjali, as already I think previous presenter already defined that the yoga is the yoga chitta vritti nirodha. So this Yoga Sutra start from Atha Yoga Anusasanam. So very fundamental and basic question is what is yoga? So Maharshi Patanjali says yoga is a discipline. Now then there is a question, which kind of discipline can be categorized as a yoga? Then he said yoga chitta vritti nirodha. Yoga is mental discipline. So now he clarified what is yoga. So he said yoga is chitta minus vritti equal to yoga. So chitta is the mind, vritti is different activities, and nirodha is a management. So then he said there are two types of vrittis, klishta vritti and aklishta vritti. Means in nutshell we can say the mind is the sum of the thoughts, imagination, emotion, memories. So these thoughts, imagination, memories, emotions can be categorized in two categories. One is a klishta, means any thought, any imagination, any emotion, any memory which is responsible for self-degradation, means it is going to degrade someone, that called klishta vritti. Another is a aklishta vritti, means any thought, any emotion, any imagination, any memory which is helping for self-upgradation. So that called klishta and aklishta vritti. So Maharshi Patanjali said that as a human being, we are always filled with both kinds of vritti. We have a positive and negative thoughts. We have a positive and negative imagination. We have a positive and negative emotion. We have a positive and negative memory. So to survive, to sustain, and to upgrade ourselves, we have to do chitta vritti nirodha. So initially he said that there are three different types of mind. So he categorized the mind in three different broader categories. First category, the disturbed state of mind, which is technically discussed in the Vyas Bhasya as a kshipta, mudha, vikshipta, which is known as the disturbed state of mind. Second is the disciplined state of mind. It is known as the ekagra. And third and the last one is a dissolved state of mind, which is known as the Niruddha Bhumi. So now Maharshi Patanjali says, as a human being, we have three different functions of mind, three different states of mind. Sometimes our mind is a disturbed, sometimes it is disciplined, sometimes it is dissolved. Then he says there are five types of vritti, which are known as the pramana, viparya, vikalpa, nidra, smriti. So the simple interpretation of these five vrittis is that as a human being, we cannot physically move in the past into future, but mentally it is possible. So Mahasi Patanjali says that either first we can connect with our present. So whenever we are going to connect with our present, so that connection is also two types of valid and invalid. If that connection is a valid, means whatever things are front of my senses and I am going to perceive, I am going to recognize as it is, then it called pramana. Another possibility is that the things is something different and my cognition is different, than it is known as viparya. Then Maharishi Patanjali says another function of mind, that mind can move in the future, which is known as a vikalpa, imagination, the form of imagination. Another vritti he is explained, which is the smriti, means mentally we can move into the past in the form of just reliving our memory. And at last he said the fifth one is the nidra, means when we are not aware. So now we can categorize the function of mind in two categories. One, the function of aware mind, another is the unaware. Unaware is the known as the deep sleep nidra. Aware mind can connect with present. So again, this present connection will be two types of valid and invalid. Valid is a praman, invalid is a viparya. The futuristic connection is known as a vikalpa. The past connection is known as a smriti. So these are five functions. So there are three different states of mind, which are known as a disturb, discipline, and dissolve. Five functions of mind means how mind is operated. Now, Maharishi Patanjali is saying that as a human being, as we are already filled with both types of vritti, means our mind is a sum of good and bad thought, good and bad imagination, good and bad emotions, good and bad memories. But we have to categorize that which one is helpful and which one is the somehow destructive for us. So he said very first we have to control our negative vrittis. So he introduced a method of mental well-being which is known as a abhyas and vairagya. So abhyas and vairagya has a different deeper meanings, but as a layman or just a primary understanding, we can understand what is the abhyasa. Abhyas means whatever our good vrittis are, means good thoughts, good emotion, good imagination, good memory, that must be uplifted, that must be enhanced. And what is vairagya? Vairagya means whatever we have a negative mental activities that must be controlled. So Abhyas and Vairagya, these are the two tools. By that we can control our mind, we can upgrade ourselves. Mahasi Patanjali says that there are four different approaches to explore the outer and inner world. Very first he said that whenever we are going to perceive anything or observe anything or to understand anything from outer world, then there are four possibilities. We can perceive things being in raga state, means influenced by the likes. We can perceive things being influenced by the dvesha, means by dislikes, or we can perceive the things being udasin, means disinterested. So according to Mahasi Patanjali, whatever knowledge we are going to acquire from the outer world, why do we need to acquire the knowledge from outer world? Because on the basis of that knowledge we are bound to behave. So our behavior, our activities, our response, our reaction, we need the knowledge. And then what are the knowledge? So again he said that knowledge are further categorized in two forms. The valid knowledge means which is not acquired udasin. So what is the true form of acquiring true knowledge? So he says tada drashtuhu sarupe avasthanam, means being a true observer. By adopting a drashta bhav, we can perceive outer world as it is, then our behavior will be always neutral. Then second, he said, if a person is not ready to adopt that drashta bhav, then he always will be fluctuated according to the changes happening in outer world. And he said, vritti sarupyam itratra. So very simple technique of mental health, mental well-being according to Mahasi Patanjali is that first we have to know what are the three different states of mind, what are the five functions of mind, and what are the state which is known as a prejudiced mind and neutral mind. So whenever we are anything perceiving on the basis of our prejudiced mind or preoccupied mind, then our perception will be partial, then our behavior will be also partial. Then whatever we are perceiving, whatever we are reacting or responding, that there may be gap. Then almost there may be ups and downs in the form of sukha and dukkha. So the simple funda according to Maharishi Patanjali to achieve a mental well-being is that just adopt the drashta bhava. So what is the drashta bhav? Means be neutral, because as a human being our brain is lethargic. So brain always love to develop a pattern. So always brain is not going to be active and recognize or perceive each and everything same thing with just a new perspectives or new approaches. So Maharishi Patanjali says be attentive. And the same approach is nowadays very popular in the form of mindfulness. What is the mindfulness? That called the drashta bhav. Means either or even more, whenever you are doing same activities more than 1,000 times, do it as new or being fully aware. Now coming to the Bhagavad Gita. So in the Bhagavad Gita, the state of mental well-being is known as the Sthita Pragya. Sthita Pragya, a very unique contribution of Bhagavad Gita given to the humanity. So what is the Sthita Pragya? So very well defined or explained in the second chapter, the 55th shloka, which is known as the definition of Sthita Pragya. Prajahati yada kaman sarvan parth manogatan atmannev atmana tushtaha sthit pragyas tadochyate. So this is a kind of capsule which represent framework of mental well-being. So the simple meaning of this shloka is that who will be mentally well-being, who will be mentally fit, who is mentally healthy. So this shloka said a person who is able to control his desires, and also he or she is a self-satisfied. Means according to Bhagavad Gita, there are two parameters to be mentally healthy or to achieve a mental well-being state. So one is a person who can control his or her desires, and second, a person who is a self-satisfied. So these both conditions are compulsory to be mentally healthy. So first, control the desire. Normally, there is a contradiction if in our day-to-day life, whenever we are going to analyze our day-to-day life behavior. So the satisfaction is the outcome of fulfillment of desire. But this shloka is just stating a very contradictory statement that a person must control his desires and he or she must be the self-satisfied, which is technically primarily seems impractical. But there is a practicality. And what is that practical essence? Practical essence is that, again, here a person must control his desires. So, as already I stated, desire, or it is also very close to vritti. So, there are two types of desire. Certain desires which are essential, important, necessary to survive and to upgrade ourselves. Certain desires which are not necessary but are playing a great role for our degradation. So Bhagavan Sri Krishna very simply saying, just identify, just classify your desires, and whatever desires or thoughts or emotions or imagination or memories are responsible for degradation, that must be controlled. One. Second, whatever is important, that must be practiced. If any thought is good for self, for the society, that must be practiced. Second, a person must be self-satisfied. So till now, whatever discoveries, whatever researches, whatever experience we have, according to that, we conclude that satisfaction is the outcome of the fulfillment of desire. But Sri Krishna in the further shloka in the same chapter, he says that satisfaction is the inbuilt feature of each and every human being. Only we have to put efforts to discover our that inbuilt self-satisfaction. And he said, Param Drishtva Nivartate. How we can achieve that inbuilt inner satisfaction, how we can enable that inner inbuilt satisfaction, so we will be not chasing blindly the outer world for that kind of relaxation or satisfaction. He said a person must explore his or her inner world, and for that he says param drishtva nivartate. Because by birth we are bound to practice that satisfaction is the outcome of the fulfillment of desire. Accordingly, we are going to just follow this simple pathway. But he said, no, it is not complete or perfect pathway. It is just a partial perception that by fulfilling the desires, a person will be satisfied. He says, no, if a person is going to explore the inner world, by exploring the inner world, he can experience, which is the term is used as a ananda, then all dependency, all kinds of blind attachment, all kinds of addiction, all kinds of dependency, only and only in the outer world will be vanished. Then a person who is a self-control means who can recognize his positive, negatives, upgrading, degrading, desire, emotion, imagination, memories. Second, he is a abhyas, again he is a determined or dedicated to implement only positive thoughts. Then the person will be called as a sthit pragya. So first we have to recognize, categorize our desire, then the must or upgrading desire must be practiced and degrading must be avoided. That exactly is known as the abhyas and vairagya. Second, for the self-satisfaction, we have to follow the pathway of yoga, especially the pranayama and dhyana. By the pranayama, our mind and senses are more relaxed, and once mind and senses are more relaxed, then we can experience that the satisfaction or the gratification, the satisfaction, or it is inbuilt. It is not only the outer. It is not only dependent on the outer world. So in nutshell, we can. I tried to summarize what is the view of Maharishi Patanjali or Bhagavan Sri Krishna has explained in the Bhagavad Gita and a Yoga Sutra, which is known as the mental well-being. Although there are various aspects discussed, and the complete full paper I also shared. So yeah, I hope it may be available to the audience so they can read, and all the detailing they can get from my this research paper. If any question, if anybody is willing to ask, you may ask, please. Yeah.
Thank you so much,
So
sir.
that's all from my side. Thank you.
Thank you
Any
so
question,
much.
any discussion is required, please let me know.
Yes, if any question from the audience side, you can ask regarding this research paper presentation. Anyone? Okay. One thing I should know, sir, that you are from a prestigious institute of India in the field of yoga. So, is there any possibility, as you mentioned about the layers of the chitta, means Chitt, Vikshit, Mood, Ekagra, and Niruddha, they are also correlated with the somehow state of human mind. So, the possibilities of making such questionnaires regarding these chitta or the consciousness or some deep variables which help us to more discover about mind and all those things. So, sir, what is your opinion and what is your futuristic plan in this field?
Yeah, sir. You have a very wonderful idea. Definitely, as it is mentioned in the Shastra, that there are five states of mind: Kshipta, Mood, Vikshipta, Ekagra, Nirusta. So definitely, a questionnaire must be developed. That so on the basis of that, we can conduct research and we can conclude. So I think there is a one spiritual questionnaire. I'm not damn sure about it that it is very popular or not. So sometime in our research, we are using just to assess the triguna. So sattva, rajas, tamas, because these fives are just outcome of that triguna. So already a questionnaire is a exactly. I'm not able to presently recall the name, but there is a spiritual questionnaire, something called it is developed by any Indian author. So they assess the triguna, and so we are using that same triguna questionnaire for the assessment of these five states of mind. We are already doing, but yeah, as you said that separately we can develop a questionnaire which is totally centered and focused to measure these five types of state of mind, and also some variables may be created so we can conclude something objectively. So definitely we can work on that. But till now in the institute we are using that Triguna questionnaire for the assessment of these five different states of mind.
Yes, Triguna, there are two versions as per my opinion. One is the Vedic Personality Inventory by Dr. David Wolf, USA, and one is from the Indian author. So
Now,
yes,
David Fowler, definitely one is another is one more. I'm not able to now recall the name of that also. Can you name the author? Who is
uh,
the second one?
the Vedic Personality Inventory was developed by Dr. David B. Wolf, WOLF.
Yeah,
Yes, and
and
second one
another
is
one.
uh, I think he is an acupressure expert. So from DSVV or Dev Sanskriti Vishwavidyalaya, as per my knowledge. I
Mhm.
don't know
No,
what
I think
personal.
what exactly I'm trying to recall, it is something different because
Yes, it may be
that
different.
being used for Triguna. So Vedic personalities have a different questionnaire. So what exactly we are using it is different. So I will share with you. And but definitely we have to work to develop a new questionnaire because if there are psychology expert in our institute. Also there are psychology expert. We have a yoga expert and some other neurologist, someone who can contribute for it. So definitely we can develop a new questionnaire which will be very effective, especially for the Chitta Vritti assessment and Chitta Bhumi assessment.
Yes, it is my a request, a kind of to all of the present here, because we are when we talk about the Vedic or the yogic perspective, then we have little bit lack in this field. So yes, it's our collective responsibility. So under the guidance of yours or other dignitaries, the professors here who participated in this conference. So yes, we should look in this field also to developing reliable and valid questionnaires in the field. So yes, thank you so much sir,
Definitely,
for
definitely.
your
Thank you, sir. Thank you.
insightful presentation. Okay, so now we have Pranav Raj. If you are here, you can go for the presentation.
Yes, sir. I'm here. Yes, sir. Yeah. Thank you for that opportunity. Yeah, I will be sharing my screen. Hope my slides are visible.
Yes, sir.
So,
Visible.
yeah. So, good afternoon, all. My name is Pranav Raj. I'm basically a clinical psychologist working at IIT Tirupati. So, I'm also a research scholar of Abiti University, Chhattisgarh. Today I'll be presenting our rapid review titled Untapped Potential of Strength-Based Approach to Mental Health Among Indian Adolescents. So the study was contributed to synthesize available evidence on positive youth development and strength-based approaches in the Indian context. And this work was being formally registered in Prospero and ensuring transparency and methodological rigor. We know that adolescence is one of the most critical development stages where biological, psychological, and social transition that shapes mental health and well-being, and also as well as physical health. So globally, 13 percentage of the disease burden among 10 to 19 years old in due to mental health disorder. In India, the National Mental Health Survey 2015-16 reported a 7.3 percentage prevalence of adolescents' mental health disorder. Yet access to care remains very limited. Only about 41 percentage of Indian youth even believe seeking help of mental health issues is beneficial. So this situation is further worsened by stigma, shortage of trained counselors or psychologists, and lack of mental health literacy in school. So this context call for an approach that does not just treat mental illness but focus on promotion and promoting positive mental health, and there where the positive youth development or PYD comes in the role. So coming to what is positive youth development approach. So positive youth development or PYD is rooted in positive psychology. Instead of focusing on deficit or disorder, it focuses on strength, resilience, and well-being. So the PYD model emphasizes what we call in 5 C's like competence, confidence, connection, character, and caring. So this element collectively nurture resilience and self-efficacy, helping adolescents flourish even in challenging environment. So this is backed by Broden's and Bill theory, which states that positive emotion expand one's cognitive and behavioral capacity, leading to long-term well-being. So, in other words, positive youth development focus on building thriving youth rather than just preventing the problems. So, coming to the rationale of the review, we notice that many interventions are fragmented. Some are embedded in life skill program, some in school mental health schemas, and others are community activities. But there hasn't been a systematic synthesis in what's actually working. So, additionally, most programs are limited cultural adaptation, inconsistent measurable of outcomes, and poor scalability. So, therefore, the purpose of the rapid review was twofolded: to map existing PYD and strengthen based intervention of adolescents' mental health in India, and to identify key implementation gap and future direction of research and policies. Coming to the objectives, the first objective is to examine the efficacy and scope of various interventions. This includes school-based, community-based, and digital, individual, and family-based model promoting adolescents' mental health using PYD framework. And second, to identify research and implementation gap that can inform the design of future programs, especially those that are scalable and culturally relevant to the Indian context. So these objectives guide our entire methodology and synthesis process. Coming to methodology overview, so we adopt a rapid systematic review designed following PRISMA 2020 guidelines to ensure transparency and reproducibility. So the search covered multiple database corpus, PubMed, and Web Science, Google Scholars, etc., as long with a key Indian journals and government reports also. So the search period spanned from January 2005 to March 2024. Out of that, 678 records identified, 32 studies met the inclusion criteria and were included in the final synthesis. And the review protocol was registered in Prospero the Prospero ID is as in the slide. And the further strengthening methodological integrity, this design allow us to map both academic and policy level intervention related to PYD India. Coming to the inclusion criteria, the study had to focus on Indian adolescents aged 10 to 19. The need to be they needed to be empirical and including randomized control trials, QC experimental studies, mixed methods, or the program evaluations. And interventions had to include at least one PYD component, such as youth leadership, life skill development, or sustained adult-adolescent relationship. So we included only English language human-based studies conducted in this India. And exclusion criteria, we excluded studies that did not directly address positive youth development program or adolescent mental health. Non-empirical articles like editorials, commentaries, or pure theoretical papers were excluded from the study. And we also omit non-English publications due to accessibility limitations, as well as studies involving non-human subjects. Coming to the search history, our search strategies combine keywords like positive psychology, youth development skills, mental health, and mental health and India using Boolean operations like and or. And an overview of the study selection process using Prisma framework. Our database search literacy identified 678 records. After removing duplicates and screening titles, the abstract 103 records were shortlisted for fully texted assessments. Of this, 32 studies met all inclusion criteria and were retained for the qualitative synthesis. So this remaining articles were excluded primarily due to lack of PYD focus, insufficient outcome data, or theoretical design. Coming to the result. So the characteristics of included studies. This studies collectively represents adolescents aged of 10 to 19 years of both urban and rural India. About half of the interventions were school-based, making schools the most common settings from PYD implementation. So around 25% were community-based, including peer-led and NGO-supported programs. In terms of methodology, we found 6 randomized control trials, 13 QC experiment studies, 5 qualitative and 2 cross-sectional studies. Then life skill educations was the most frequent intervention type, and followed by mental health promotions and gender equality programs. Then this diversity reflects a growing but still fragmented evidence based in India adolescents in mental health field. Uh, Coming to the risk of bias summary, so we assessed the quality of all included studies using JBI critical appraisal tools, and overall selection based was highly in approximately 81% of the studies, largely due to non-randomized designs and convenience sampling. And performance and detection bias were moderate to high in about 24 studies, and mainly because of unblinded or interventions and reliance on self-reported data. So policy evaluations such as those assessing RKSK and Ayushman Bharat had high reporting bias due to incomplete outcome data. However, RCTs like Sheher and Bright demonstrate strong methodological rigor and were rated as low risk, contributing to high quality evidence. And we have also school-based intervention studies consistently produce the stronger and most reliable outcomes. For instance, study implementing life skills and psychological curricula such as the Sheher trials and enhanced life skill programs reported a 52% increase in mental health literacy, improved resilience and emotional regulations and significant reduction in depression and also bullying in schools. So community-based study interventions also showed subsequent promise, especially in under-reserved population. So the Girl Health Campaign program, for example, improved adolescents' health knowledge by 1.5 times baseline and boosted positive health attitude by over 40%. The Kishore Panchayat models also in rural Maharashtra enhance the life skill and leadership among adolescent girls. So these are the tables. Using the GRADE framework, we have categorized the overall evidence of strength across study types. So RTCs such as Shehar and Girls First provide high quality evidence due to the randomized designs and large sample size. And the QC experimental studies offered uh, moderate quality evidence showing consistent effect but limited by small samples and lack of control group. So qualitative and policy evaluation were related to low to moderate, and they relieved on uh, descriptive outcomes. Yeah, descriptive outcomes rather than standardized measurements. So coming to the thematic insight, schools are highly effective platforms for PYD delivery due to their reach and structure. So peer-led programs foster engagement and substantially empowering the adolescents as a change agent. And life skill trainings consistently improved emotional regulations, coping, and social skill across the settings. And urban-rural divide has evident urban intervention tend to show more stronger results, likely due to better infrastructure and across the facilities. And gender focused program that involved families or community stakeholders had more sustainable behavior outcomes. And we identify the gaps that there is a lack of digital or family based intervention even through smartphones access in rapidly increasing in India. And few studies include adolescents voice in program design limiting cultural and developmental relevance. So and outcome measures were heterogeneous and making comparison with meta-analysis very difficult. And many studies that had short follow-up periods of small samples affecting long-term validity. And finally, rural and tribal populations remain under responded actually, and despite being most at risk of limited access and stigma. The discussion part, when interpreting these findings, we see a clear message that PYD approach works, but need contextual strengthening. School programs like Shahar and Pride provides robust evidence that structured PYD framework can enhance the resilience and mental health literacy. However, deep-rooted stigma and cultural barriers such as a collective family norms have to be there, should be there in the limited programs uptake. And urban interventions tend to show greater success than rural ones, underscoring the need of equitable like resource allocations. And family engagement and culturally adapted materials or instance using commonly idiom like tension, instead of we can use tension instead of anxiety, so they can those words will more acceptable for those society. And overall, PYD offers a scalable, low-cost solution if integrated with India's existing education and health structure. And coming to the policy and implementation, like based on our reviews, several policy implementations can be emerged. Integrate PYD principle directly into school curriculum to promote socio-emotional learning. Train teachers and lay counselors as facilitators. ensuring sustainability even in low resource schools, and adopt peer-led and community participation model to promote ownership and engagement, and expand low tech digital tech digital platforms such as commerce or community radio to reach rural youth effectively, and encourage government or NGO partnership for the program implementation. And the research and practice recommendation conduct large scale recommendation controlled trials using the standardized outcome measures to enhance the reliability, and incorporate youth and family perspective during the program designed to ensure the cultural fit, and building multi-sectoral collaboration involving schools and NGO can be adopted. The goal should not just reduce the distress, but to promote thriving, resilience, and confidence youth. Conclusion. To conclude, this rapid review highlight the strengthen-based and PYD approaches hold tremendous potential to enhance adolescent mental health in youth. Evidence from schools-based and peer-led programs clearly demonstrate improved resilience skill and mental health literacy. However, this current research landscape is still fragmented and methodologically uneven. So moving forward, we must integrate PYD framework into both educational and public health with strong community and family engagement. So by doing so, India can truly leverage its youth demography dividend to build a mentally healthy and emotional resilience generation. Thank you.
Thank you. Are you getting my voice?
Yes, yes.
Thank you so much, sir, for such a wonderful and insightful presentation.
Thank
If
you.
anyone has any query or question from the audience side regarding this presentation, you can ask. Okay, sir, I want to ask one thing to mention in the discussion of this research work,
Yes.
that the success rate of urban areas is higher than the rural ones. So, according to what were the we can say causes, or in your opinion, what are the reasons behind it? How, why the success rate give only provide insight
Yes,
why
yes, sir.
there is a difference?
Yes, just because of the infrastructure and the availability of mental health. Like in urban area, we have a lot of psychologists. But when it comes to the town areas, the psychologists, psychiatrists, and all the mental health things are available. But comes to the village part, they does not know about what is the mental health, and they think that it's a double process. So when a student have any psychological issues, they directly go for some kind of like what we call as baba bega, right? They directly go and approach them instead of seeking a mental health. So first we have to start from our school, that mental health seeking a psychologist is not wrong. So when I read through this lot of reviews, we have lot of researches happens in town area, and like Bangalore, Delhi, but not in the villages area. So we have to strengthen the mental health promotion in those kind of areas. So
Yes, thank you so much. And you have an experience in the field of clinical psychology. So,
yes.
according to you, in few main points, two or three main points, according to your experience, what are the main causes that are affecting the mental health of adolescents in present time,
Yeah.
according to you?
First thing I should say that it is parenting is the one of the biggest thing, because now the adolescent kids parents are very young age, or they are like 80s born and 80s born, so they don't know how the generation has transformed from like we call it as Gen Zs. So how this transforms? So these people are not accepting, and they are training they're parenting them as the way they got. So the new generation has transformed, and the like not give my opinion, the mobile phone, we usually say that we should not give mobile phone, you should not meet tablet, you should not use computer. Okay, in those time, okay, it is very rare. But this time, if we hide this mobile, the children will be very curious of searching what is happening inside the mobile, and they started some behavior to seek that. So we should be very openly communicated whatever happens. So when the parents start communicate, the students communicate it back. When the parents start hiding, the students also start hiding. So the communication between the parents and the students should be very open in the parenting time, and the parents have to spend uh, some amount of time with their children. So that's the best thing which we can give our adolescent children. So
Thank you so much. I think everyone should see this suggestion or the advice in a realistic way and try to adopt it how much level it can adopt it. Thank you so much, sir, once again for your valuable presentation.
thank you, thank you. Yeah.
So now moving to next, we have Samriddhi Pass from the MT Institute of Behavioral and Allied Sciences, MT University, Chhattisgarh. So please, ma'am, if you are there, you can proceed your presentation.
Yeah, good afternoon, everyone. Am I audible, sir?
Yes, ma'am, you are audible.
Yeah, I'll just share my screen. Sir, is it visible, the screen?
Yes, ma'am.
Yeah. So, the topic of my presentation is Emotional and Behavior Problems in Autism Spectrum Disorder, a systematic review. Autism spectrum disorder, which we also call as ASD, is a developmental disability caused by differences in the brain. People with ASD often have problems with social communication and interaction and restricted or repetitive behaviors or interests. People with ASD may also have different ways of learning, moving, or paying attention. It is important to note that some people without ASD might also have some of these symptoms, but for people with ASD, these characteristics can make life very challenging. Children and young people with ASD, a lifelong neurodevelopmental condition affecting approximately 1.2% of the population, have an increased risk of developing mental health problems, including anxiety and depression. Population based studies suggest that up to 40 to 50% of children with ASD have emotional and behavior problems at a level of clinical concern. In addition, approximately 41% of young people with ASD may meet the criteria of two or more mental health disorders. Emotional and behavioral problems occur more commonly in children with autism spectrum disorder compared to other children. A UK study of children with ASD and intellectual disability identified high levels of emotional and behavioral difficulties, with only a minority accessing mental health services. According to teachers of pupils in primary school population in Singapore, pupils with ASD had an elevated level of behavior problems, including disruptive or antisocial behavior, self absorption, communication disturbance, anxiety, and social relating in comparison to a group with multiple disabilities. While the emotional and behavioral difficulties associated with having an ASD diagnosis are well known, there has been less focus on the challenges facing this group of children and young people and investigating the factors associated with these difficulties. ASD is a neurodevelopmental disorder characterized by difficulties in social interaction, communication, and repetitive behaviors. Individuals with ASD are at higher risk of developing emotional and behavioral problems, which can significantly impact their quality of life. This systematic review aims to synthesize the existing literature on emotional and behavioral problems in individuals with ASD with a focus on prevalence and characteristics and associated factors. The method which was used in database, so Sodhganga, Eric, Google Scholar, Science Direct, etc. were searched. We also conducted a systematic review on PubMed database for the research using mesh term. The review highlights the high prevalence of emotional and behavioral problems among individuals with ASD, including anxiety, depression, attention deficit hyperactive disorder, and conduct disorder. The findings emphasize the need for early detection, comprehensive assessment, and culturally sensitive interventions to support individuals with ASD and their families. The high prevalence of comorbid psychiatric disorders among individuals with ASD underscores the need for comprehensive assessment and treatment approaches that address both the core symptoms of ASD and associated mental health issues. The studies reviewed also emphasized the importance of early detection and intervention, as timely identification and support can significantly impact the long term outcomes of individuals with ASD. The use of culturally sensitive screening instruments such as the MCHAT-R is crucial in the Indian context where cultural and linguistic diversity can impact the accuracy of diagnosis. The development of context specific interventions that take into account the unique needs and challenges of individuals with ASD and their families in India is essential. The discussion underscores the need for comprehensive and a multidisciplinary approach to supporting individuals with ASD and their families in India. This approach should include early detection, intervention, and support services, as well as research and policy initiatives that address the unique needs of challenges of this population. And by understanding the complexities of ASD and its impact on individuals and families, policymakers, healthcare professionals, and researchers can work together to develop effective strategies to improve the lives of individuals with ASD and their families in India. With this, we came to the conclusion that overall the results of this review highlight the need of culturally sensitive and context specific strategies to support individuals with ASD and their families in India. By understanding the prevalence, characteristics, and associated factors of ASD, policymakers and healthcare professionals can develop effective intervention to improve the lives of individuals with ASD and their families. These are the references which was used. Thank you. That's it from my side, sir.
Thank you so much, ma'am, for insightful presentation regarding emotional and behavioral problems in autism. So if anyone has any query or question regarding this presentation, you may ask. Okay, so now going to the next participant. Jyoti Dhai, you are present here, you can proceed. Or anyone who is right now in the meeting, if you have not presented yet, you can present. Yes, Rajkumar.
सर आवाज आ रही है सर मेरी?
आवाज आ रही है, काफी स्लो आ रही है आपकी आवाज।
नो सर, ऑडिबल। अब आ रही है सर?
जी।
Namaste to everyone. Good afternoon. Namaste to everyone. Today I want to present the paper. My paper title is Use of Intelligence Data in the Reducing Psychological Stress in Older Adults. This topic is related to intelligence data. Intelligence data is the data that is collected in the artificial intelligence or that interpret the result of the data collected in the large amount that interpret the human mind and develop their thoughts and cognition and then remove the stress. The intelligence data is particularly related to the artificial intelligence, in which you conclude the accumulation of data in her. You human being cannot accumulate data in large amounts. They can involve the things that is our artificial intelligence can have a huge and complex data put in your mind, but human mind cannot put complex huge data in his mind. So artificial intelligence, yeah, intelligence data can help beneficial for the reducing psychological stress. And now older adults are particularly called the senior citizens whose age is between plus 62 plus and called older adults. This particular पेपर इज particularly फेस ये पेपर मुख्य ये बता रहा है कि जो हम कैसे हम आर्टिफिशियल इंटेलिजेंस और अपने डाटा कलेक्शन के द्वारा स्ट्रेस को हम लोग कम कर सकते हैं और उसको और बेहतर करने की प्रयास किया जा सकता है. फर्स्ट ऑफ ऑल जैसे AI इज कंप्लीन फॉर सीनियर सिटीजन. आई नो अभी की जो आधुनिक जमाना चल रही है इसमें डाटा आर यूज इन असिस्टेंट प्रॉब्लम्स that has become a close pulse and also facilitated to senior citizens. These citizens aged from 62 years and above are selected as a target group, or they are mainly called the older adults or yeah, senior citizens. Main aim of this paper is the evaluate effectiveness, how the agencies offer emotional friendship to reduce stress and love in absence of their kith and kin, how they helpful bring their well-being, their life and happiness. Our first, the research aims to fill the gap by evaluate the effectiveness of intelligence data to mitigate psychological stress in older adults. Second is to design and implement tailored stress reduction strategy for older adults based on real-time intelligence data for enhancing their emotional intelligence. Third is managing psychological stress, support in the form of emotional friendship and love. This is a one short and experimental a pilot study with 80 participants where participant was conducted and preliminary assessed these aspects for revealing high levels of stress related to monetary concern and potential. Global context and literature review. As I read the consumer minimum paper for this only 25 literature review done in this paper, mainly focus on the aging demography and challenges. Now, global population is 60 plus expected to nearly double by 2050. That is 2.1 billion. Among poses challenges for healthcare, financial service, and labor markets. Loneliness and psychological stress are major concerns requiring community engagement and social programs. These are the global demography and challenges and the AI adoption and digital divide. AI can enhance quality of life by telemedicine, and smart home devices. And this digital device divide exists with older adults facing barriers to access and use of joy and yeah, and used by him digital device just you can use the Apple device that is Siri and chatbot for any knowledge for the from the artificial intelligence. Assistive technology is a wearable device you can use smartwatch. Smartwatch provide the body temperature, yeah, um, body temperature, your pulse rate, or your oxygen level. They help for their health and data-driven wellness. Integrating intelligence data allows caregivers to identify stress triggers through behavioral pattern that is sleep or social interaction. Predictive models enable proactive interventions like specialized yoga, counseling, mindful activities, enhancing mental well-being and security. This AI intelligence data or AI is mainly found out the this can provide the specialized yoga that's any problem you face in the situation, and they also help in counseling. If you put any questions in front of him, we provide the questions account through the app. And mindful activities, any mental security you will want to know from that what you can provide the detail what by prompt. The world aging population, Japan has the highest aging population by disease data from 2015 to 2030. In Japan, this time aging population is 70.1. After 15 years, that become double. That is 30.3. So as you know, from China has is no, two times double. I think 2.5 point doubles. The aging population increases day by day, and this is USA, particularly India. India has the as you know the youth country. Their aging population is much less from the others country. Methodology I have used in this is mainly focused on pilot study. Man, the participants particularly participate in a total older adults that is equivalent from the Haridwar, that is one Haridwar Patanjali one first ashram. A second is the requirement sample size probably for pilot research to identify emerging patterns and ensure diversity. Stress criteria mainly found the stress criteria I can found use the PSS scale, that is perceived stress scale used for the find out the stress criteria. From the methodology, I found that the stress identified 77.8% indicated high stress due to financial insecurity. 66.7 reported stress from loneliness or family just in AI assistance emotional support. Many maximum required AI assistance emotional support from the many participants. It is short. I have collected 18 participants, but minimum I have randomly choose five participants for the result. That is mainly age is between the 62 plus 85. This is the year of retirement, 10 years. The contractor and remain more or contractor and this participant also is educated and uneducated, yeah, illiterate, unliterate. Their spiritual source worker, PhD, and household many maximum government teacher. Yes, the minimum age of participant was 69.2 years. The sample included diversity in the retirement status and their occupation and education problem. Primary monetary concerns and technology uses. The financial stress and multiple responses, just as healthcare, in paying the current future healthcare costs by family members, that they pay the payment in the health insurance. The health insurance very useful for their future and retirement planning. Uncertainty about the feasibility of the current retirement plans and children's milestones. desire to fund children's marriage after feeling insufficient, pension and derivative for pension not supporting previous lifestyle concern about paying debt. These are all the financial stresses they felt in the after retirement. But by using the technology AI technology, they got the real time information and they overcome this problem. And scam can scam and AI violence related to financial scams and lack of knowledge regarding AI in finance. Lack of knowledge is problem in this and challenges of this, and they know the knowledge according to her. 12 day mean after the collecting the data from the 18 participant, you have 12% daily mobile banking use. Most participants use mobile, and use AI. Four have no knowledge about the AI about this. Discussion regarding this is the intervened stressor and design implications. Monetary concerns are complex, interrelated with family responsibility, implementation, and socio-economic factors. They face the challenges and financial uncertainty, psychological stress, and causing anxiety and advocacy and emotional isolation in 77.8% of the sample. They feel problem in the sleep disturbance and the other things. Design application for a financial intelligence data system, integrated support, provide daily financial information from the AI chatbot, or they empower older adults, customize stress management chatbots offering empathetic response and take interaction from this. But mostly our finding illustrate that the monetary concerns of older adults are unique and complex. They often intervene with family responsibilities and socio-economic factors such as such as uh, um, such as inflations in government policies and low birth rates affecting pensions. These concerns are strongly linked to psychological stress, with participants reporting heightened anxiety, feelings of inadequacy, and emotional isolation. For instance, worries about the healthcare cost and retirement planning is exacerbated stress, leading to sleep disturbance and reduced well-being in the in the older adults. Based on this one, we suggest two design implication for financial intelligence data system focused on stress reduction. Provide daily financial information integrated with psychological support features such as mindfulness prompts or virtual companionships to elevate anxiety during monetary decision making. Empower older adults to take the initiative to interaction with intelligence data, allowing them to customize management tools. Example, AI chatbots offering empathetic response to financial worries. These implications aims to transform AI from a mere information tool into a holistic stress mitigator to fostering emotional resilience. Conclusion from this is conclusion. This pilot investigations offer primarily evidence on the potential role of artificial intelligence in addressing financial stress and promoting psychological well-being among the older adults. Although the limited sample size contests the generality of the results and findings provide a valuable foundation for future large-scale expanding the sample in subsequent studies will enable stronger essential analysis and a more nuanced understanding of how intelligence intelligence database tools can influence stress management and financial decision making in aging populations. These insights underscore the need for human-centered design principles in developing intelligence data-driven financial system tailored to older adults. By emphasizing usability, trust, and stress reduction, such systems can enhance emotional resilience and decision confidence. Overall, this study contributes to human-computer interaction and granting chronology literature by reframing aging as a phase of continued growth, adaptability, and empowerment rather than decline or isolation. And this is a reference and acknowledgements you appreciate our participants for their valuable data and anonymous reviews for constructive feedback. And these are my references. Thank you so much to everyone. Om sir.
Thank you so much for your
Yes.
presentation regarding AI, artificial intelligence, and mental health. So, if anyone has any query or question, you can ask. Okay. So, thank you so much once again. Now, I think one more participant we have in this meeting right now. So, I would like to call Abhay Sharma for presenting his research paper.
Sir, good evening, sir. I'm not able to share my screen. Can I send my presentation to you and then you can share?
It is in the PPT or the PDF?
Sir, PPT.
Okay, you can share.
Okay, sir. Thank you.
Till anyone else who is in this meeting is not presented yet, because I think this is our last presentation for today. Or anyone in your colleague or known or as a author and a co-author, or anyone from your similar institute or similar class or similar subject, they've also registered but not able to present their paper online. So you can also inform them.
Sir, I forwarded it to you. Please check.
Yes, I'm opening and presenting.
Namaste, sir.
I think PPT. I think PPTs are visible to everyone right now, so you can start.
Okay, so good evening, everyone. My name is Abhay Sharma, and my topic is relationship of sun with pigmentation in plant, yogic diets, and kundalini. So here the introduction part. Modern lifestyle is affected by pollution and impure diet containing harmful chemicals that impact human health. The sun, as the ultimate source of energy, support life through photosynthesis and nourishes humans indirectly via plants. Sunlight offers several health benefits, killing bacteria, improving sleep, and lowering blood pressure. In ancient Indian literature, the sun is revered as a deity and symbolizes energy and vitality. This study explored how sunlight influences plants, pigments, yogic diets, and Kundalini awakening process. So there is a literature review in which Margareta Moga 2022 in the Journal of Parapsychology describes seven chakras that absorb prana and maintain body mind balance. Each chakra is linked to a color neural network, glands, and emotion. Color changes reflect a person's health and emotional state. Chakra activation is often associated with Kundalini awareness. Then there was a second paper published by Rakesh Gupta in which he introduced color therapy, that is chromotherapy, using visible light to heal mind and body. Practiced in India, Egypt, and China for centuries, used to influence mood, behavior, and mental health. And then there is third study done by Gracies 2020 explore healing with colors, color frequency, affect brain and body response, promote alternative medicine and emotional well-being. Then the fourth study, which named as integration of color and intensity, which focus on light, color, and intensity, help stabilize circadian rhythm even under cloudy skies. Then fifth studies was done by Jablonski and Chaplin 2010. Human skin pigmentation and UV radiation found that melanin evolved to protect against UV rays and maintain vitamin D levels. Then six studies, Gabriel's in 25, spiritual nutrition proposed rainbow diet, linked food colors to chakras and spiritual growth. Seventh, Anju Singh, that is the research paper was sunlight and anthocyanin pigmentation in maize. Ultraviolet B light induces plant pigments, that is anthocyanin. Sunlight triggers enzyme activity. Eighth and last, Pathak in 1976, sunlight and melanin pigmentation explained among tanning as solar-induced melanin production enhancing UV protection. Now focus on the research paper main part, that is spiritual significance of the sun. If we consider Shvetashwar Upanishad, there is chapter 4, verse 1, which state that the one who is colorless through union with his energy creates many color for his divine purpose. Into him, the world merges at the beginning and the end. May that divine being bless us with the pure understanding. And the Ayurveda concept, as per Ayurveda Acharya, that is Shushruta, just as moon, sun, and air sustain the world, the balance of Vata, Pitta, and the Kapha sustain human health. Planetary movement of the solar system influence these three doshas. Symbolism of seven horses of the sun. There is a wheel in the chariot of the sun. Seven horses are yoked. The seven horses respect seven colors, seven chakras, and seven forms of energy. Each symbolizes a vital cosmic principle sustaining life and consciousness. There is another mantra that we can found in Rig Veda, that is chapter 1 164.2. Seven horses are attached to one wheeled chariot of the sun. The single horse, known by seven names, derives this eternal chariot. Its three hubs support worlds and keep them in harmony. Now, there is a scientific and yogic significance of the sun energy. Let's focus on that. Seven radiation of the universe. In modern science, if we consider that seven main radiation and energies are active in the universe, that is cosmic energy, UV radiation energy, visible light radiation energy, infrared radiation energy, radio radiation energy, X radiation energy, and last gamma radiation energy. And now let's focus on the Vedic tradition. These seven energies are symbolized as seven horses of the sun, representing different wavelength of energy that influence life, nature, and consciousness. The seeker, while meditating upon these seven horses, aspire for self victory, balance, and inner illumination. That is sort of enlightenment. Now, sunlight and the photosynthetic pigment. Let's focus on the scientific part. Sunlight absorbed by the plant is primarily through chlorophyll, but carotenoid, flavonoid, phycobilin, and anthocyanin and also play a role. These pigments are responsible for variety of colors in plants and fruit and for capturing different wavelength of the solar radiation. The absorbed sunlight is converted into chemical energy during photosynthesis, forming the foundation of all life. Human indirectly obtain these solar energy through consumption of plant-based food. Now, types of photosynthetic pigments and their synthesis. First, chlorophyll, produced in chloroplast from glutamic acid through enzyme catalyzed reaction, gives plant their green color. Carotenoid, found in plant, fungi, and some bacteria, derived from phytoene, provide red, yellow, and orange pigmentation. Then phycobilin formed the reduction of biliverdin, essential for light absorption in cyanobacteria and algae. Now anthocyanin, a branch of flavonoids pathways formed through chalcone synthase activity give purple, red, and blue color. Now flavonoids synthesize the phenylalanine via phenylpropanoid pathway, protect plants from UV radiations and oxidative stress. These are the pigmentation and their color, edible substance, and the effect of the body. You can look into the slide. The brown color is given by the folate pigmentation, which and its effect on the body is help in blood clotting. Same with cottonite, its color is red, yellow, and orange, found in black bell pepper, spinach, corn, etc. And its effect on the body, it's help in the decreasing the risk of disease, particularly eyes disease and cancer. No flavonoid, which give color pale yellow and white. Its effect on the body is anti-cancer, anti-inflammatory, and have antiviral properties. Now, anthocyanins give purple color and it reduce the risk of cancer, heart disease, and also lessening the effect of arthritis. Now, isothiocyanate and indoles give green colors, which reduces the risk of heart disease. And there are several other couples of pigmentation which have beneficial effect of the human body and give various color like orange, red, and green. Now let's focus on next slide, that is yogic and Ayurvedic perspective. According to Garen Samhita, the concept of Patyahara emphasis food nourishes both the gross body, that is Annamaya Kosha, and the subtle body, spiritual layer. Plant-based food is considered sattvic and they carry solar energy and promote spiritual growth. Jackfruit, carotenoid, bitter gourd, chlorophyll, flavonoids, carotenoids. Then root vegetable which contain anthocyanin, cucumber contain beta carotene, berries and brinjal contain anthocyanin, leafy green contain chlorophyll, banana contain carotenoid, anthocyanin, and flavanol. Now, the subtle aspect of the Annamaya Kosha relates to spiritual science. The gross aspect relates to physical anatomy. Through meditation or dharana on the sun and the sattvic diet, the body and the mind achieve harmony, awakening higher consciousness. Now, let's focus on the Kundalini concept and awakening. In Hatha Yoga, Kundalini awakening is one of the most important spiritual practice. Kundalini is described as serpent-like energy lying dormant at the base of the spine, that is Muladhara chakra. It rises through six chakra in the spinal column and unites with Lord Shiva at the Sahasrara chakra. Awakening is done through sun meditation, that is Surya Dhyana, visualizing sunlight entering from Sahasrara and flowing down through all the chakra to the root, that is Muladhara chakra. Sun is also present in the body in the form of Kundalini. When a gland develops in the physical Muladhara, the life force of the sun is established in it and it awakes states is like the sun. That is, in the human power become omnipresent and omnipotent like power of the sun. then it became difficult to control that power. The deity is Gayatri, that is Savita, and the representative the power of Kundalini is also Surya. There are a couple of mantras which states as when the Kundalini Shakti awakens, the seeker feels filled with light in all five cells. The five cells, six chakras, three glands, 24 valleys become illuminated and reflected to the seeker. Meaning, by meditating on the sun, one get mysterious knowledge of the universe. This is Kundalini Siddhi. So there is finding sunlight plays a vital role in energy absorption and transformation in the plants. Chlorophyll is the main pigment responsible for capturing sunlight. Sport other pigments like carotenoid, flavonoid, phycobilins, and lycopene. These pigments are present in various plant-based food that serve as a source of natural energy for human. The energy derived from plants nourishes Annamaya kosha and sport both physical and subtle aspects of the body. A sattvic diet rich in plant-based food refines the Annamaya kosha and promote overall health and purity. Text highlight the link between Panchakosha and Kundalini awakening, emphasizing the six spinal chakras and the Sahasrara chakra at the crown. Meditation on the sun is considered essential for chakra activation. Focus on sunlight flowing through the spinal chakra. Now focus on the conclusion. The study reveals a deep connection between sunlight, plant pigmentation, and human well-being, both physical and spiritual. Sun- Sunlight not only sustained life through plants, but also support spiritual awakening through solar meditation practice. The integration of sunlight, diet, and meditation demonstrate a holistic balance between nature, nutrition, and spirituality. Maintaining a sattvic balanced diet is practicing sun focused meditation can enhance vitality, clarity, and consciousness that we discussed earlier. This research encourages further exploration of the relationship between natural energy, human physiology, and spiritual evolution. Now, these are the references and the websites. Any question from your side, you are free to ask. Thank you so much. And if somebody wants to know about the Panchakosha theory, which is given in the Taittiriya Upanishad,
Yes,
Briguvalli.
thank you so much for such a unique presentation, integrating nature and spirituality in a realistic and scientific way. So, anyone has any query or question regarding this research work, you may ask. Anyone? One question is from my side, how we can correlate nature and mental health, as it is also a theme of this conference. So, in your opinion, what is the connection between nature and mental health and how they are impacting each other?
Okay, sir. So my view regarding this, the natural and mental health, if our nature is in balanced position, if we consider the Ayurvedic perspective, that is Vata, Pitta, and Kapha, if these are in balanced state, then our mental health, not only mental health, our physical aspect or all dimension of human body can also be in balanced state. If we consider the nature, the types of the nature, that is tamasic, rasic, and sattvic, then if we all balance these kind of gunas of the prakriti, it also leads to the betterment of the mental health or in the balancing of mental health.
Thank you so much. And if in this meeting anyone left who is not presented their research work till they can their last chance before winding up today's presentations, they can tell. And thank you so much everyone for your uh, valuable presence and sincere listening and continuous efforts to we joined this session of the research paper presentation on occasion of International Conference on Mental Health and Well-being, and it is held at Sri Guru Ram Rai University, Dehradun, uh, this year on the 11th of October, as you everyone knows. And a few things I would like to share with you that as mentioned, the conference proceedings will be published with the papers or the abstract as per the discussion with the university authority and all those things. And second thing is the certificates of the online presentees like you who present today. It will be delivered within a week to your email through which you are registered in the conference. So be update with your email and it will be delivered through mail. And if there is any problem, any correction or any kind of problem you have, you can mail us and you can put your query, question or problem in the WhatsApp group also, or you can directly assess me or the ma'am or the other people concerned responsible people. So don't worry about anything and all things will be completed and delivered very soon. And last, if any participant who is still left in the communication with the participants who are here in this meeting right now, so you all should inform them also. So I think the presentations have been done. The offline were the yesterday and online are today. So now we are moving towards the closing of this online presentation. So at last, if anyone has any query, question in general, or anyone want to share something, you can. You are welcome.
Hello, this is Dr. Moni. First of all, I would like to congratulate or say thanks to all of you to organize this workshop. And since the beginning, I'm attending and listening so many researches. And कुछ रिसर्चेस मुझे बहुत अच्छी लगी, जैसे वो ब्राह्मी पे थी, एंड अभी लास्ट में जो अभय शर्मा की जो कॉन्सेप्ट था, फिर जो बीच में हमें योग निद्रा पे हमें सुनने को मिला. तो फॉर मी पर्सनली इट वाज क्वाइट एनरिचिंग, काफ़ी नॉलेजेबल था. एंड ऑफ कोर्स इट्स प्लेटफॉर्म जिसने मेरी स्टूडेंट को भी एक अपॉर्चुनिटी दी कि अपना वो पेपर प्रेजेंट करे, ऑल्दो शी वाज बहुत नर्वस थी. बट ओवरऑल आज का एक्सपीरियंस बहुत अच्छा था. सारे रिसर्चेस मैंने सुने एंड काफ़ी हेल्पफुल रहे सर ये. सो एट लास्ट इट्स अ heartfelt gratitude. Thank you for organizing this workshop or conference. Sorry, conference from my side.
Thank you so much, ma'am, for your valuable presence. And under your guidance, your students or anyone's student, they will grow in the field. Everyone has a first time in their career, whether they are
Yes,
paper
sir. Yes,
presentation
sir.
or at
Yes,
what.
sir.
So our prime focus is to collective work towards the research and on the national level means we have to represent India that we have also ability to produce such a authentic, reliable and valid research works in every field and especially
Yes.
the
Yes.
conference
Agree, sir.
related.
Agree, sir.
Yes.
Oh, okay, sir. Thank you, sir.
नमस्ते
Thank you so
सर.
much.
सॉरी सर, एक्चुअली मेरा नेटवर्क इशू था, तो उस टाइम पे आपको मैं सुन नहीं पाई पेपर प्रेजेंट करने के लिए. क्या अभी 5 मिनट्स मिल सकता है या फिर जैसा भी शेड्यूल हो आई कैन एग्री?
मैम आपका अभी प्रेजेंटेशन नहीं हुआ इसमें?
नहीं हो पाया था, एक्चुअली नेटवर्क इशू हो गया था. मैं आपसे बात करना ही चाह रही थी, तो बात
ठीक
नहीं.
है, आप यदि रेडी हैं तो आप 5 मिनट लेके आप प्रेजेंट कर सकते हैं.
जी ओके, थैंक यू सो मच सर.
इसके अलावा और कोई जो यहाँ मीटिंग में है जिनका प्रेजेंट ना हुआ हो तो आप अभी बता दीजिए हमको, क्योंकि ये लास्ट प्रेजेंटेशन है, इसके बाद हम इसको वाइंड अप करते हैं.
सर प्रेजेंट हो रहा है क्या?
अभी नहीं शो हो रही है स्क्रीन आपकी.
ओके, अब हो रहा है क्या?
जी.
आवाज क्लियर है मेरी?
जी जी क्लियर है, आप प्रोसीड कीजिए।
थैंक यू सो मच सर। सो मेरा टॉपिक है साइकोलॉजिकल एनालिसिस ऑफ इमोशनल स्टेबिलिटी थ्रू टीचिंग्स ऑफ द श्रीमद् भगवद गीता। थैंक यू सो मच सर, एंड थैंक यू ऑल ऑफ यू टाइम देने के लिए। मेरा नाम प्रज्ञा मांझी है। आई एम रिसर्च सीनियर रिसर्च फेलो यूनिवर्सिटी ऑफ पतंजलि। तो जैसा कि हम जानते हैं कि जो श्रीमद् भगवद गीता है वो टोटली बेस्ड है इमोशनल स्टेबिलिटी पे। जैसा भी हम पूरे योग शास्त्र मतलब 18 अध्याय है उनमें भगवान श्री कृष्ण ने अर्जुन को उपदेश दिया है और उनपे मन विचार भावनाओं को नियंत्रित करने के लिए और सही चैनलाइज करने का एक डायरेक्शन बताया गया डिवोशन के थ्रू। तो उसी के बारे में हम देखेंगे। जो मेरा रिसर्च पेपर है वो मेनली इमोशनल स्टेबिलिटी है, जिसके ऊपर हम भगवत गीता के टीचिंग्स और उसके डिवोशंस, उसके जो भी पाथ्स हैं उनके बारे में हमने स्टडी किया। तो सबसे पहले ये बात जानने की जरूरत है कि इमोशनल स्टेबिलिटी होता क्या है। एक्चुअली हम लाइफ में बहुत ज्यादा सफर करते हैं, बहुत सारे ऐसे सरकमस्टेंसेस आते हैं जहाँ पे हम बिल्कुल अपने आप को निराश और हताश महसूस करते हैं, जिसकी वजह से हमारे लाइफ में बहुत सारे प्रॉब्लम मल्टीप्लाई होते जाते हैं। और उसका मेन कारण यही कि हम इमोशनली स्टेबल नहीं हो पाते हैं। तो इमोशनल स्टेबिलिटी इज द एबिलिटी टू मेंटेन कंपोजर एंड रेजिलियंस एमिड स्ट्रेस, क्रूशियल फॉर इफेक्टिव डिसीजन मेकिंग। बहुत बार हमारे साथ सिचुएशन आता है कि हम किसी भी काम को अच्छे से नहीं कर पाते, वहां पे बहुत सारे कंफ्यूजन और क्योस क्रिएट होते रहते हैं जो हमें प्रोडक्टिविटी की ओर नहीं लेकर जाता। लेकिन भगवत गीता हमें सिखाता है कि हमें कैसे अपने आप को बैलेंस रखना है, और वो उस बैलेंस के थ्रू हम लाइफ के कोई भी डिसीजन हो या कोई भी काम हो उसमें अच्छा परफॉर्म कर पाते हैं। नेक्स्ट, साइकोलॉजिकल पर्सपेक्टिव्स ऑन इमोशनल रेगुलेशन। तो मॉडर्न अगर एंशियंट स्टडीज की बात करें और साइकोलॉजिकल स्टडीज की बात करें तो उसको हम रिलेट कर पाते हैं कि जो भी एंशियंट एजुकेशन आई मीन जो भगवत गीता में हम पढ़ते हैं कि कैसे अपने मन को बैलेंस करना है, कैसे अपने भावनाओं को अपने नियंत्रण में रखना है, वो उसको समझ के हम साइकोलॉजिकल पर्सपेक्टिव को बहुत अच्छे से समझ, चाहे हमारे वो बिहेवियर एटीट्यूड हो या मेंटल इमोशनल जो भी सारे एलिमेंट्स हैं। तो इमोशनल रेगुलेशन involves managing responses to stress, ensuring mental balance, adaptive behavior in challenging situation। क्योंकि सिचुएशन ऐसा ही क्रिएट होता है कि जहां हम बैलेंस कर ही नहीं पाते हैं, तो यहाँ पे ये हेल्प करता है। नेक्स्ट है इमोशनल स्टेबिलिटी इन कंटेम्प्रेरी रिसर्च। तो कंटेम्प्रेरी रिसर्च इज लाइक कि आज हर फील्ड में और हर एक सेक्टर में हमें कहीं ना कहीं वो स्ट्रेस है, वो परेशानियां हैं, और हर एक इंसान इस चीज से सफर कर रहा है। कोई सीवियर, कोई माइल्ड और कोई मतलब नॉर्मल, लेकिन हर तरीके से वो किसी ना किसी रूप में सफर कर ही रहा है। तो इसमें बहुत सारे ऐसे रिसर्चेज हुए हैं जो हमने अभी देखा, अपने रिसर्च में पढ़ा। जस्ट एक ओवरव्यू कि इसका क्या कंटेक्स्ट रहा है। तो हिस्टोरिकल एंड फिलोसफिकल, जो कि एक हमें फाउंडेशन मिलता है, एक आधार मिलता है, वो चाहे हमारे श्रीमद् भगवत गीता की बात हो या उपनिषद या वेदों की बात हो, जहाँ पे मन विचार भावनाओं पर केंद्रित किया गया है और उसे मतलब अच्छा रखने के लिए योग के मार्ग में चलने के लिए बताया गया है। क्योंकि योग ही वो शक्ति है जिससे हम अपने आप को बैलेंस कर सकते हैं। क्योंकि श्रीमद् भगवत गीता में कर्मयोग, भक्ति योग, ज्ञान योग के बारे में बताया है। नेक्स्ट है द गीताज इन्फ्लुएंस ऑन मेंटल वेल। तो गीता, भगवत गीता पूर्ण रूप से हमें भावनाओं को नियंत्रित करना सिखाता है, अपने मन को सही दिशा में लगाना सिखाता है, जो कि भगवान श्री कृष्ण अर्जुन को समझा रहे हैं। और वही चीज हमें आज एज अ गिफ्ट मिला हुआ है, जिसके थ्रू हम अपने लाइफ को बैलेंस कर सकते हैं। नेक्स्ट है की थीम्स रेलिवेंट टू इमोशनल कंट्रोल। सेम यही चीज है कि जब हमारा इमोशन कंट्रोल में होता है, ये हमारे लिए एक प्रोमिनेंट रोल प्ले करता है कि हम डिटैच्ड होके अपने सारे कामों को करें। इसी पे हम आगे भी बात करेंगे। जो कर्मयोग हमें सिखाता है कि कोई भी हम काम करें उसमें अनासक्त भाव होकर कार्य करें, क्योंकि जब आसक्ति होती है तो हमारा अटैचमेंट बढ़ता है, वही अटैचमेंट है, और उस अटैचमेंट की वजह से हमें प्रॉब्लम सफर करना पड़ता है। यदि हम डिटैच होके काम करें तो हम फ्री, बंधन मुक्त हो जाते हैं, और वही बंधन मुक्त होने के बाद ही हम अपने बाकी सारे काम को अच्छे से कर पाते हैं और उसका रिजल्ट भी अच्छा मिलता है। तो ये एक ओवरव्यू हो गया। नेक्स्ट हम चलते हैं इक्वानिमिटी की बात जो हुई है, जैसे बाकी जो चार योग है, कर्म योग, ज्ञान योग, भक्ति योग, राजयोग, वो एक अलग हो गया, लेकिन उसी में एक कंसेप्ट आता है दूसरे अध्याय में, स्थित प्रज्ञ, जो इक्वानिमिटी को बताता है। एक तो श्लोक हो गया जो हमारे मुख्य श्रीमद् भगवद गीता में है, योगस्थ कुरु कर्माणि संगम त्यक्त्वा धनंजय सिद्ध सिद्ध्यो समो भूत्वा समत्वम योग उच्यते। तो जो योग है वो क्या है? समता है, जहाँ पे हम सुख दुख, लाभ हानि, जय पराजय, उन सभी में सम रहते हैं। लाइफ में कितनी भी प्रॉब्लम्स हो, अगर हम सबको बैलेंस लेके चले तो कभी हमें कोई प्रॉब्लम बड़ी नहीं लगती, वो इजिली शॉर्ट आउट हो जाती है। लेकिन हम अपने भावनाओं पे नियंत्रण नहीं होता और हमें हमारे विचारों पर नियंत्रण नहीं होता, इसलिए कोई भी प्रॉब्लम हमें बड़ा ही लगता है। लेकिन जब हम श्रीमद् भगवद गीता पढ़ते हैं या उनके टीचिंग्स पे काम करते हैं तो हमें समझ आता है कि ये जो भी हमारे साथ हो रहा है इसको हमें कंट्रोल करने की जरूरत है, और यही हमारे लाइफ को बैलेंस और एक सही डायरेक्शन में लेकर जाएगा। तो ये स्थित प्रज्ञ के बारे में बताएगा। बहुत सारे श्लोक जो 2.54 से वो सारे शुरू हो जाते हैं, प्रजहाति यदा कामान सर्वान पाथ मनोगतान। फिर आगे भी है, क्रोधात भवति सम्मोह सम्मोहात स्मृति, मतलब बहुत सारे हैं, क्योंकि वहां पे हम अपनी इच्छाओं को तो बहुत सारे रखते हैं लेकिन वहां पे वो फुलफिल नहीं होता और हम परेशान होके फिर मतलब बोलते हैं ना कि जो चीज हमें नहीं मिलती है उसके पीछे जब हम भागते हैं तो हम परेशान होते हैं। वही जब हम कर्म योग करते हैं, निष्काम भाव से कार्य करते हैं, ईश्वर को समर्पित करके कार्य करते हैं, तो वो हम बैलेंस काम फील करते हैं। लेकिन जहां बर्डन वहीं पे फील होता है जब हम चीजों को पाना चाहते हैं कि हमें ये चाहिए तो चाहिए। तो यहाँ पे यही बताया कि डिटैच होकर कार्य करना है, और स्थित प्रज्ञ व्यक्ति वही है जो अपने जिसकी बुद्धि स्थिर है, जिसका माइंड काम है, तो वो हर एक सिचुएशन में अपने आप को बैलेंस रखता है और सभी परिस्थितियों में समान रहता है, वही स्थित प्रज्ञ है। बताया कंपैरिजन विद मॉडर्न साइकोलॉजिकल constructs, equanimity in the Gita parallels modern constructs like emotional regulation and resilience, emphasizing balanced states. तो हर एक अध्याय में योग को अलग अलग रूप में बताया, चाहे वो अर्जुन विषाद योग की बात हो, आत्मा का स्वरूप की बात हो, स्थित प्रज्ञ हो, कर्म योग, ज्ञान योग, भक्ति योग एंड संन्यास योग। सबके मूल में सिर्फ एक ही है कि वो है इमोशनल स्टेबिलिटी। वो अगर हमारे साथ होता है तो हम बाकी सारे काम को अच्छे से कर पाते हैं। तो यही हम इस स्थिर प्रज्ञ से समझ सकते हैं। तो हमारे लाइफ में स्थित प्रज्ञ होना बहुत जरूरी है। बहुत मतलब बहुत सारे मिथ्स हैं कि संन्यास योग या संन्यास का मतलब ये होता है कि आप भगवाधारी हैं या कुछ कपड़े ले लिए या आपने संन्यास लेके आप गुफाओं में कंदराओं में चले गए। लेकिन श्रीमद् भगवद गीता बिल्कुल इस बात को क्लियर करता है कि संन्यास का मतलब होना है कि हमें डिटैच रहना है और अपने काम को निष्काम भाव से करना है, तभी हमें उपलब्धि हासिल होती है। लिटरेचर रिव्यू में हमने देखा कि 2021 की एक स्टडी है जिसमें एनालिसिस देखा गया, जिसमें समत्व रहने की बात की गई है और कर्मयोग ज्ञान योग को के बारे में, उसका अलाइनमेंट के बारे में बताया कि हमारे जो इमोशनल रेगुलेशंस होते हैं उनको कंट्रोल किया जा सकता है, उनको मत। और आज के टाइम पे जो साइकोथेरेपी या साइको कॉग्निटिव थेरेपी, जितने भी ये सारे रिसर्चेज हो रहे हैं, ये जो सारे टॉपिक्स हैं, इनमें काम किया जा सकता है उसके रिलेशन से उनको कनेक्ट करते हुए। 2022 की एक स्टडी है जिसमें एम्पेरिकल और रिव्यू पेपर भी हुआ, जिसमें डिटैचमेंट फ्रॉम आउटकम्स ड्यूटी विदाउट अटैचमेंट। तो वही मैंने बताया कि कर्मयोग में भगवान श्री कृष्ण जो कहते हैं कि विदाउट अटैचमेंट से आप सारे काम को सही कर सकते हो। अपने स्ट्रेस को भी, मैं आज स्ट्रेस इसी चीज का है कि हमें हमारे डिजायर फुलफिल नहीं हो रहे हैं, और वो ऐसे कि वो बहुत हाई लेवल पे है। ऐसा भी नहीं है कि हमने मेहनत किया और बाद में हम अपने आप को बैलेंस कर पाए, नहीं, हमारी एक्सपेक्टेशन इतनी ज्यादा होती है कि हम स्ट्रेस में चले जाते हैं, डिप्रेशन में चले जाते हैं, और ये सीवियर मेंटल हेल्थ को मतलब आपके साथ बना रहता है, और वो कंटिन्यू फिर बहुत सारे मेंटल डिसऑर्डर्स के रूप में हमारे सामने दिखाई देता है। फिर नेक्स्ट है नरेटिव रिव्यू हाईलाइटेड द प्रैक्टिकल रिलेवेंस ऑफ द गीता फॉर एवरीडे मेंटल हेल्थ केयर एंड साइकोथेरेपी, सजेस्टिंग इंटीग्रेशन विद सीबीटी एंड माइंडफुलनेस टेक्निक्स। तो कॉग्निटिव बिहेवियर थेरेपी में भी यही है कि आप अपने मन को अपनी बुद्धि को कैसे सही दिशा में लगा सकते हैं। तो ये सब हमारे मेंटल हेल्थ केयर और इमोशनल रेगुलेशंस के बारे में ये सब बताते हैं। नेक्स्ट देखेंगे 24 में जो हुआ था, क्रिटिकल एनालिसिस कंपेयर्ड गीता टीचिंग्स विथ मॉडर्न साइकोलॉजिकल कंस्ट्रक्ट्स प्रोवाइडिंग structured frameworks for developing intervention that promote emotional stability। इसमें हम ये भी देखा गया कि जो भी गीता टीचिंग्स है वो आपके इमोशनल स्टेबिलिटी को प्रमोट कर रहा है, मतलब बढ़ा रहा है। कुछ ऐसे डिजाइन हुए, मैंने और भी यहाँ पे मेंशन नहीं है लेकिन और भी मैंने रिसर्च पेपर पढ़े जिसमें क्वेश्चन डेवलप हुआ है। एक्चुअली मेरा भी जो टॉपिक है पीएचडी का वो साइकोमेट्रिक स्केल डेवलपमेंट है। तो वहां पे भी हमने देखा कि जो भक्ति योग करते हैं या जो इस दिशा में रहते हैं वो कहीं ना कहीं थोड़ा बहुत, बहुत ज्यादा नहीं, वो प्रैक्टिस से होगा, लेकिन ये पाया गया कि जब हम ईश्वर को समर्पित करके कार्य करते हैं तो कहीं ना कहीं वो बैलेंस हमें फील होता ही है। तो यहाँ पे यही बताया। नेक्स्ट है रिसेंट वर्क एक्सपेंडेड टू अप्लाइड रिसर्च, सिस्टमेटिक डिस्कशन हुआ जिसमें मल्टी और इंटरडिसिप्लिनरी भी देखा गया, जिसमें साइको न्यूरो इम्यूनोलॉजी पे और न्यूरो साइंस पे भी काम किया गया है। और ये भगवत गीता सच में हेल्प करता है कि हमारी जो कॉग्निटिव एबिलिटी है ये बूस्ट होता है और स्ट्रांग होता है, ये देखा गया। नेक्स्ट लास्ट चलते हैं रिसर्च मेथोडोलॉजी। तो हमने ये तो क्वालिटेटिव और एक्सप्लोरेटरी रिसर्च हमारा रहा जिसमें हमने गीता के टीचिंग्स को, जितने 18 अध्याय हैं उनमें से कुछ मुख्य श्लोक को लिया और जितने भी जो कमेंट्रीज जिनके हुए हैं, जैसे शंकराचार्य हैं, विवेकानंद जी हैं और बिंदु हैं, और भी बहुत सारे हमारे हैं, प्रभुपाद जी को भी मैंने रेफर किया था। तो उनसे हमें काफी रिसोर्सेज मिलते हैं जो इन सब पैरामीटर्स पे काम करते हैं। योगा साइकोलॉजी, पॉजिटिव साइकोलॉजी और इमोशनल रेगुलेशन पे मॉडर्न जो रिसर्च है उसको हम कनेक्ट करके हमने ये स्टडी किया था। नेक्स्ट है methodological consideration for studying the गीता एंड इमोशनल स्टेबिलिटी। तो आगे इस पे और भी काम हो सकता है और अभी हम और भी ज्यादा इसमें काम कर सकते हैं इंटीग्रेशन के थ्रू। इंटीग्रेटेड क्वालिटेटिव एंड क्वांटिटेटिव दोनों को हम एम्पेरिकली दोनों को रिलेट कर सकते हैं, कहीं रिसर्च कंडक्ट करा सकते हैं। ये मैंने देखा इसलिए ये यहाँ पे मेंशन कर दिया। मेजरमेंट टूल्स जो साइकोलॉजिकल स्केल, साइकोमेट्रिक स्केल यूज हुए हैं उनको भी हमने देखा। इस integrate validated psychological skills with culturally adapted gita based emotional stability indicators for robust measurement। तो एक मेजरिंग टूल हमें मिल जाता है जब हम क्वेश्चन डेवलप करते हैं कि उनकी जो थिंकिंग एबिलिटी है वो किस डायरेक्शन में है, वो क्या सोचते हैं, उनके बिहाफ पे हम वो रिजल्ट फाइंड कर सकते हैं। और एथिकल कंसिडरेशन, मतलब जो भी हमारा एंशियंट टेक्स्ट है, भगवत गीता है, उसको हम एक्सपर्ट से वैलिडेट करा सकते हैं उस क्वेश्चन को डेवलप करने के बाद। वो मेरे पास्ट स्टडी में ऐसा हुआ था। इसका जो एप्लीकेशन है वो कैसे हो सकता है ये हम देख लेते हैं। माइंडफुलनेस एंड मेडिटेशन टेक्निक डेराइव फ्रॉम द गीता। तो ऐसे तो पढ़ के भी या फिर उनके स्वाध्याय से भी होता है, लेकिन इसको हम एप्लीकेशन में ऐसे भी ले सकते हैं कि रिसर्च कंडक्ट करा के, मतलब इम्पेरिकली, कि वो दो भागों में डिवाइड किया जा सकता है, जो भगवत गीता पढ़ रहे हैं, जो नहीं पढ़ रहे हैं। तो ये एक बहुत अच्छा हेल्प मिल सकता है इस भगवत गीता टीचिंग से, जहाँ पे हमारे इमोशनल रेगुलेशन और जो भी थॉट्स प्रोसेस है वो सही और क्लियर डायरेक्शन में होगा, और जितने भी मेंटल डिसऑर्डर्स हैं उनको भी हम सप्रेस कर सकते हैं, मतलब खत्म कर सकते हैं। और केस स्टडीज के भी थ्रू हम इमोशनल स्टेबिलिटी को इम्प्रूव कर सकते हैं, जहाँ पे डिटैचमेंट के बारे में बताया जाए, इमोशनल रिजिलियंस के बारे में बताया जाए। और ये हर प्रोफेशन या हर सेक्टर में है, तो उन इस केस स्टडीज के थ्रू हम इस पर काम कर सकते हैं। पोटेंशियल फॉर इंटीग्रेटिव थेरेपी मॉडल्स, तो बहुत सारे साइकोलॉजिकल थेरेपी, साइकोथेरेपी है, सीबीटी है, और भी बहुत सारे हैं जहाँ पे ये हॉलिस्टिकली काम कर सकता है, क्योंकि हॉलिस्टिकली अभी लास्ट किसी प्रेजेंटेशन में किसी एक सर ने बोला कि WHO की जो डेफिनेशन है, हेल्थ इज अ कंप्लीट स्टेट ऑफ फिजिकल, मेंटल एंड सोशल वेलबींग। तो यहाँ पे हम ये भी देख सकते हैं कि इमोशनल वेलबींग जो भी जितने भी मतलब हॉलिस्टिक हेल्थ की अगर बात करें तो ये सारे इंक्लूड हो जाते हैं। और इमोशनल हेल्थ और इमोशनल स्टेबिलिटी का होना हमारे लाइफ में बहुत जरूरी है, जिसके थ्रू हम आगे के काम को अच्छे से कर सकते हैं। तो इसमें जो भी सारी चीजें हमने पढ़े उसमें फिर हमने ये देखा कि फ्यूचर रिसर्च की क्या क्या अपॉर्चुनिटीज हो सकती हैं इसमें ना। तो एमर्जिंग ट्रेंड्स इन क्रॉस कल्चरल साइकोलॉजिकल स्टडीज। तो भगवत गीता टीचिंग्स को साथ में लेकर हम साइकोलॉजिकली बहुत सारे काम कर सकते हैं, क्योंकि साइको एनालिसिस या साइकोसोमैटिक डिसऑर्डर्स पे जब हम भगवत गीता के टीचिंग्स को लेते हैं वहां पे, जैसे अगर हम बात करें तो भगवान श्री कृष्ण ने अर्जुन को एक तरह से साइकोथेरेपी ही दे रहे हैं, जिससे वो अपने आप को स्टेबल फील कर पा रहे हैं और फर्दर वो अपना स्टेप लेने के लिए रेडी हो रहे हैं। फिर है पोटेंशियल फॉर ब्रॉडर एप्लीकेशन इन मेंटल हेल्थ। मेंटल हेल्थ सेक्टर में भी इन चीजों को बढ़ाया जा सकता है, उस पर एप्लीकेबल कराया सकता, एग्जीक्यूट कराया जा सकता है, क्योंकि भगवत गीता की हर एक श्लोक, चाहे वो म्यूजिक के माध्यम से हो या पढ़ाने के माध्यम से हो, लेक्चर के माध्यम से, बहुत सारे टेक्निक्स हम यूज कर सकते हैं जहाँ पे एक इंडिविजुअल पर्सनैलिटी को उसका लाभ मिल सकता है। लास्ट जो एक फाइनल थॉट है, जो एक समरी निकल के आता है, वो इंटीग्रेटेड भगवत गीता टीचिंग्स ऑफर्स इनोवेटिव पाथवेज फॉर एडवांसिंग इमोशनल स्टेबिलिटी रिसर्च। तो जो भी हमारे फर्दर रिसर्च होंगे उसमें इमोशनल स्टेबिलिटी पे बहुत ज्यादा काम हो सकते हैं, क्योंकि आज के टाइम पे हर एक इंसान इससे सफर कर रहा है। सब कुछ होते हुए भी हमारा मन, भावना और विचार केंद्रित नहीं है, वो उसमें उनमें एक रूपता नहीं है। यदि हम सामने काम कर रहे हैं तो हमारा मन, विचार, भावना कहीं और लगा हुआ है। तो ये हमारे लाइफ में बहुत ज्यादा प्रॉब्लम है, क्रिटिकल कंडीशन है सबके साथ। तो इस रिसर्च के थ्रू हम इन चीजों को कम कर सकते हैं। ये हमारा मेन मोटिव था इस रिसर्च पे काम करने का। तो थैंक यू सो मच, आपने इतना समय मुझे दिया। थैंक यू
Thank you.
सर।
Thank, thank you so much for your presentation and insightful talk. So, if anyone has any query or question before winding up this, so you can ask.
Ma'am, I have a like couple of question and just another curiosity. Ma'am, what is the philosophical purpose of Gita? One, and second, just a curiosity, मैम। जब हम भगवत गीता को के चैप्टर को देखते हैं तो एक जगह पे सांख्य योग के बारे में चर्चा हुई है, चैप्टर 2, विच इज टॉकिंग मेनली अबाउट आत्मा जो ना मरती है, ना
जी।
ना उसको ना पियर्स किया जा सकता है, एक्सेट्रा एक्सेट्रा। बट अगर लास्ट के चैप्टर्स में बात करें तो वहां पे कास्टिज्म या वर्ना सिस्टम की बात हो रही है। एक तरफ तो आत्मा का डिस्कशन हो रहा है और एक तरफ सोशल जो भी कंसेप्ट है उस पे बात हो रही है। तो व्हाट्स योर व्यूज ऑन दैट?
ओके सर, एक्चुअली ये जो वर्ण आश्रम या सिस्टम की बात हुई है उसमें भी कर्म के आधार पे बताया है। ऐसा भी नहीं है कि जो आप आज के टाइम पे हम जिस जाति को लेकर बोलते हैं वहां पे कर्म के आधार पर, क्योंकि हमारे शरीर में वो सभी तत्व हैं। जैसे हम अगर बुद्धि से काम कर रहे हैं तो इट मीन्स आपका ब्राह्मण वहां पे है ना। अगर हम हाथ से काम कर रहे हैं तो वो शूद्र है। तो इस तरीके से हमारे बॉडी में अब जैसे पैर है ना, पैर जो है वो शूद्र है। बाकी जो हम अभी कोई भी अगर काम कर रहे हैं तो वो वैश्य कहलाता है, मतलब जो शरीर से व्यापार चल रहा है, तो मतलब कार्य चल रहा है, उसको वैश्य बोलते हैं। तो ब्राह्मण जहाँ पे इंटेलेक्चुअल माइंड हमारा काम कर रहा है वो ब्राह्मण। तो ऐसे मतलब जो भी चार है ना, ब्राह्मण, क्षत्रिय, वैश्य, शूद्र। तो क्षत्रिय क्या है, हमारे बॉडी, अब अगर हम क्षत्रिय की बात करें तो हमारे एक्सटर्नल एनवायरनमेंट में क्या क्या, चाहे वो डिजीज हो या अनवांटेड थॉट्स हो, तो उनको भी तो हम रोक पा रहे हैं, तो वो भी एक क्षत्रिय धर्म हो गया। तो जब हम गीता के टीचिंग्स को गहराई से समझेंगे ना, तभी समझ पाएंगे। अदरवाइज तो बहुत सारे मिसकंसेप्शन और मिथ्स हैं जिसकी वजह से आज तक भगवत गीता को लोग नहीं समझ पा रहे हैं। वो ये समझते हैं कि भगवत गीता तो पूजा करने की चीज है, उसको बंद करके तिलक लगा के रख देते हैं। लेकिन उनके अंदर जो ज्ञान छिपा हुआ है, जो विजडम है, वो हर किसी को, मतलब जो योग में है, थोड़े स्पिरिचुअलिटी में है, वो तो समझ पा रहे हैं। लेकिन एक जो नॉर्मल, जो कभी जिन्होंने गीता नहीं पढ़ा, जिन्होंने कभी योग नहीं पढ़ा, उनको आप बोलो तो वो नहीं समझ पाएंगे। अरे वो तो कौन इतना पूजा पाठ करे, धर्म करे। लेकिन उनको ये नहीं समझ आता कि एक्चुअल में जो भगवत गीता है वो हमारे लाइफ के लिए कितना वैल्यूएबल है। वो लाइफ मैनेजमेंट सिखाता है। तो जैसे आपने पूछा कि आत्मा के स्वरूप के बारे में, तो आत्मा का स्वरूप के बारे में इसीलिए बताया कि ये जो शरीर है ये नश्वर है, लेकिन आत्मा जो सर्वव्यापक है, सर्वज्ञ है, शाश्वत है। तो हम जो भी काम कर रहे हैं वो हमारा शरीर तो कर रहा है, लेकिन हमारे जो थॉट्स हैं, जो हमारी भावनाएं हैं, वो हमारे साथ मतलब चल सकती है। जो भी हम अच्छे कार्य कर, वो हमारे कर्म प्रारब्ध बन के जा सकते हैं, लेकिन ये शरीर तो नष्ट हो जाएगा। तो आप किसी भी चीज की चिंता मत करो कि ये वो मेन जो कॉन्टेक्स्ट यही है ना, कि भगवान श्री कृष्ण अर्जुन को समझा रहे हैं कि तुम ये सोच रहे हो कि मेरे सगे संबंधी मर जाएंगे, ये है। इसी बात का तो कंफ्यूजन है अर्जुन के मन में कि मेरे भाई बंधु को मैं कैसे मार दूं। तभी वो समझाते हैं कि ये जो भी आपको शरीर दिखाई दे रहा है ये नश्वर है, तो ये इसके खत्म हो जाना ही बेहतर है। तो वहां पे उनको आत्मा के स्वरूप और आत्मा का मतलब जो मेन इम्पोर्टेंस है उसके बारे में बताया जा रहा है कि आप अपने काम को सहजता से करो और निष्काम भाव से करो, जो भी मैं बता रहा हूँ। क्योंकि लाइफ में जैसे आपने बताया, पूछा कि वो एक तरफ तो आत्मा के स्वरूप के बारे में बता रहा है, एक तरफ उधर। तो अल्टीमेटली यही है कि हम अपने स्वयं को जाने, हमारे लिए क्या चीज सही है। अगर हम जाति के पीछे पड़ जाए तो फिर तो हमेशा ही उसमें उलझे रहेंगे। लेकिन हम अगर इस बात को समझ जाए कि जो हमारी बुद्धि इंटेलेक्चुअल है, जो सिस्टम है, उस पे हम काम करें, हाथ है तो हम अपने बाकी चीजों को दूर करें, जो गलत है, जो गलत भावनाएं हैं, गलत विचार है ना। और जो हमारे लाइफ के लिए वैल्यूएबल है, जो जिसमें हमारी प्रोडक्टिविटी है, वो हम कार्य करें, तो फिर हम बाकी डिस्ट्रैक्शन से दूर होंगे। यही इस भगवत गीता का सार है। थैंक यू सो मच। अगर कोई और क्वेरीज हो तो।
That's it, ma'am. Thank you so much.
So thank you so much once again. And before winding up today's, this recording will also be available later. So you can also see other presentations with them online later on also. Yes. So before winding up, someone want to say something, and they can conclude in a few sentences. Otherwise, we will move.
Sir, what's your views on nature and the mental health? Just shed a light on that.
I think time is getting. I like to shed very little about it, nature and mental health. This topic or the word nature I include in the theme, or we include in the theme, because recently we saw various
हेलो।
like various
हाँ जी, हाँ, मैं यही पूछ रही कैसा था प्रेजेंटेशन।
various various fluctuations in the nature means the prakriti. The Vatpit also is a kind of prakriti. Sattvarastam is also kind of prakriti. So we are including the deepest or the subtle level of prakriti or the nature also, and we are including the outer level means the what we can see through our eyes means the forest, the flora and fauna, you can say. So, for example, one perspective is that how nature is affecting our mental health. For example, if we are sitting in a peaceful forest or in a peaceful place or near the bank of sacred rivers like Ganga, so it will definitely affect our mental health. And it in researches is also proved that the chemicals released in our brain various scientists do some researches also. So how the nature, the various elements of nature is affecting our mental health, our way of thinking, our way of perception, and our consciousness also. So in this way, we try to include nature also. So when we talk about therapeutic perspective, means we are using CBT, we are using MBCT, we are using systematic desensitization. So many therapies are used in the field of psychological treatment, cure, or the assessment of various mental health disorders. So in that way, the what will be the role of the nature can be in the field of the treatment, in the field of the other segments and elements of the mental health. So at last, I just want to conclude that mental health is not just who is suffering from some disorders. This is also a mental health issue, means who are schizophrenic, who has OCD, who has autism or something, as per the categorization of ICD or the DSM by APA or the WHO. But from the Vedic or Indian or the ancient perspective, the mental health is someone is doing corruption, then there is also a mental health issue in his or her personality. For example, I am giving this. So, what are the mental excellence? Means there are two levels: mental and normal people. Who is not normal means abnormal psychology, as we read, and the normal people enhancing their mental uh, level or the mental consciousness towards the self-realization and all those things. So in that way, we can include nature. So nature has a different meaning. So we also including in this conference the existential part of the nature. And it is also proven, you see on the Google Scholar, PubMed, or so many research oriented sites, that what is the effect of our thought in the universe and what is the effect of vibrations of the universe in our thoughts. So you can see when you visit some temple, some sacred place, then your thoughts automatically change. And when you visit some graveyard or something like that, no one is telling you anything, but your thoughts are continuously changing. When you meet some particular person, your thought, your aura is changed. So in this way, nature means we are including nature in a universal way, how the universe is affecting us and how we are affecting the universe. It is very essential thing, and if we want to stop the global challenges I include in the theme conference, the global challenges, in my opinion, all the problems in the world, whether it is America or wars are going on, the pollutions, the main reason is the mental pollution, the thought pollution. So for that reason, we have to, if we work on those concepts of mental health, mental pollution, then we truly help the humanity, truly help the nature, because if we heal the nature, nature will heal us. So yes, we are concluding the universal perspective of the nature, and it is very essential in the global challenges. Not talking only global warming. So global warming can be not treated by doing conferences and all those things. It will be treated by changing in the thoughts of an individual. So if we truly know the importance of the earth, importance of our body and all other creatures, then we truly able to change, because the materialistic lust of a human being is the main reason for the all the kinds of global challenges. It is disturbing himself or herself also. So in my opinion, mental pollution and thought pollution are the main reason, and that should be treated through the, and I would also request the people who are in the field of psychology, mental health professional, they should work in this. And what are the therapies techniques can be used, they should use it. We, our main focus is to cure and provide a universal solution to all these problems. And a true psychologist is able to solve these kinds of problems. So any problems can be treated with the help of the treatment of the, or the providing a right direction to the thought of a human being. Yes, that's from my side. Thank you so much.
Thank you, sir. What enlightening thoughts, sir. Thank you so much.
So I think time is over and we are late also. And स्पेशली जो लोग यहाँ पे जैसे मैम ने बताया कि हम स्टार्टिंग से अभी तक हैं, तो जो लोग भी यहाँ पे बने हुए हैं उनका पुनः पुनः धन्यवाद। और अन्य जो जानकारियां हैं वो आपको व्हाट्सएप ग्रुप में प्रोवाइड कर दी जाएंगी। फिर भी यदि आप में से किसी को कोई भी किसी भी प्रकार की कॉन्फ्रेंस से रिलेटेड कोई प्रॉब्लम आती है, समस्या आती है, तो आप व्यक्तिगत रूप से भी सूचित कर सकते हैं हमें या मैम को। तो यहीं पे हम इसको विराम करते हैं, और ये जो रिकॉर्डिंग है आज के प्रेजेंटेशंस की, सारे पेपर्स की, ये आपको शीघ्र ही मिल जाएगी। और यूट्यूब पे भी इसको थोड़ी सी जहाँ जहाँ पे कुछ फ्लैक्चुएशंस है वो चीज़ एडिट करके सारी रिकॉर्डिंग सुबह 11 से लेके अब तक की वो आपको प्रोवाइड हो जाएगी, तो आप फर्दर भी इसको देख सकते हैं। तो विद your permissions, with your valuable time, now I would like to wind up this session.